Good morning, everyone. We're going to be starting shortly. We do have quorum. Any paper? Actually, you know what? That's fine. Actually, I have. Yeah.
Here you go. If you need more, let me know.
Thank you.
Yeah. Thanks. Thanks for catching that. So, hold on. So for the budget items, both of them, I think I sent it to Tyler. Hopefully, he.
Yeah, good morning. Good morning. Good morning. It's Monday and everyone's so excited and bright-eyed and bushy-tailed. Okay, children. We're good to go. So in the room, we do have Councilor Perks, Director Ozude, Deputy Mayor Marley, Director Chandra Balan, Director Srish Kandaraja, and Director Sal. And online we have Director Singh and Councilor Thompson. So that's just an FYI. So good morning once again. My name is Councilor Chris Moyes, and I am the Chair of the Board of Health. The Board Secretary has confirmed that we have quorum, so I will call meeting 7 of the Board of Health to order. Welcome, everyone. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend the meeting at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I ask everyone for their patience with any delays and technical issues. The clerk staff will connect all remote registered public speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health's page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hands or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motion by email. Staff are available at boh@toronto.ca to help with motions. So we'll now do the land acknowledgement. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island and we are grateful to have the opportunity to work and live on this land. As public health professionals and members of the Board of Health, we recognize the historical and present-day traumas inflicted upon Indigenous peoples. We stand with communities and families as they mourn the loss of loved ones who were sent to residential schools and never returned. We also acknowledge our complicity in ongoing colonial violence. We commit to supporting the efforts of Indigenous groups towards reconciliation and action-oriented practices, including the equitable use of resources. We strive to learn Indigenous histories and collaborate with communities and families so we can create safe spaces that honor Indigenous cultures and ensure that Indigenous perspectives are present in our work and practices. As a Caribbean Canadian, I'm committed to continually acting in solidarity with our African, Caribbean, and Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confronting anti-Black racism, I pay tribute to those ancestors of African, Caribbean, and Black origins and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand to unmute your mic and indicate the item number and the nature of the interest. Okay, seeing none and none online. Next, we need a motion to confirm the minutes from our last board meeting on September 11, 2023. Deputy Mayor Morley, all those in favor, all opposed, carried. Okay. And I do have some remarks I'd like to start off with. So good morning once again. Today is the 7th meeting of the Board of Health. The center of our governance mandate, two fundamental facets call for our focused attention today: our budget considerations and strategic planning. These elements are the backbone of our responsibilities, and the individual role each of you play as board members is paramount in shaping the future of public health in our communities. Our strategic plan not simply documents a document, but serves as our shared vision for the next 4 to 5 years. It is a blueprint that guides our actions and resource allocation, designed to manage the most urgent public health concerns. Each of us, as board members, has a significant role in shaping our vision, mission, and values that will be outlined in our strategic plan. Your insights, guidance, and steadfast commitment will map the course of our public health initiatives for the next several years, ensuring that Toronto Public Health is equipped to navigate the constantly changing post-pandemic landscape and the new health challenges that are on the horizon. Our discussions today also encompass considerations on budget allocations. It is crucial that we comprehend the deep reach effects of our allocation decisions on public health in our communities. Our budget will not only determine our ability to execute our strategic plan, but will also influence Toronto Public Health's capacity to fulfill its mandated responsibilities. This includes funding for essential initiatives, our highly skilled workforce, necessary infrastructure, and crucial programs, all of which can compose the foundation of our public health mission, including health surveillance, population health assessment, health protection, disease and injury prevention, health promotion, and emergency preparedness and response. As we engage in our discussions today, it is important to acknowledge that the outcomes will play a defining role in charting our path forward. The decisions we make regarding strategic planning and budget allocations will greatly shape our trajectory as a public health organization. I applaud your commitment to these crucial matters, and I eagerly look forward to our discussions and decisions that will ultimately steer our journey ahead. Thank you for your relentless commitment to these vital aspects of our public health mission. And now I'm going to turn to our esteemed Dr. Davila.
Thank you, Chair, and good morning, everybody. It is nice to see so many gathered in this room for the Board of Health proceedings this morning. You know, as the fall respiratory virus season emerges, and we're hearing about this more and more in the media, I can tell you that Toronto Public Health stands ready to respond. This season does present us with the potential resurgence of respiratory illnesses, including the flu and COVID-19, and we must be ready to safeguard the health of our community. This is our paramount goal. We also have to recognize that the convergence of these viruses could place significant strain on our healthcare system, leading to adverse health consequences. And so it's in consideration of this that we know our response must be swift, it must be comprehensive, I should say, and it must be adaptable. So today, you are considering a report that outlines our strategies, our plans, and our response, and you'll hear about how we as Toronto Public Health are deploying the available resources in order to actually achieve the kind of response that I just spoke of. The effectiveness of our response to diseases of public health significance. And, you know, as you just heard from the chair, the entirety of the operation of Toronto Public Health is contingent upon having the requisite resources at our disposal. And when we talk about resources, of course, we're talking about finances or dollars, but we're also talking about a skilled and ready workforce and adequate infrastructure, just to name a few others. So at this point, I do want to extend my thanks to the board for your key role and for your leadership in helping us to ensure that there are resources available for us to do the work that we need to do in the way in which we need to do it. To meet the public health needs of our population and to undertake new responsibilities assigned to our organization by the province, including the essential work carried out by the Infection Prevention and Control, or IPAC hubs, which the board will be considering today. It is absolutely imperative that we seamlessly integrate these resources into our operational framework. And you'll hear more about that as we get into the report and the presentation. I just, you know, on the subject of resources, also worth noting and reminding the board that as we have told you in the weeks prior, there is provincial extraordinary COVID funding that has been made available as part of the COVID response. But that is indeed wrapping up at the end of this year. And as a result, we are constantly looking at our organization and adjusting our human resources and the way in which we respond so that we're able to do the work that needs to be done within the existing resource framework. Also, this is important context. As the chair rightfully points out, today the board will be considering the proposed 2024 operating budget submission and the 10-year capital budget and plan. These are important considerations that we are finding ourselves in a situation where there are some dollars that were once available during COVID that are wrapping up and work that still remains for us to do despite the wrapping up of some funding. And lastly, as you heard from the chair, members of the board will be considering Toronto Public Health's strategic planning process. And this, we hope, will serve as our guiding compass for at least the next few years. This next iteration of the strategic plan ideally will be our blueprint for aligning our efforts and resources to, as the chair just spoke to address the most pressing public health concerns, and of course, for you as the board to fulfill your obligations under the Ontario Public Health Standards. We know that we're in a post-pandemic landscape, or a rapidly approaching post-pandemic landscape that continues to evolve. We know that there are new challenges emerging. And it's in this context that our strategic plan will be instrumental in helping us to make informed decisions and set clear priorities. I do look forward to a very active discussion today. These are really rich topics, I think, for the board to engage in. And we recognize that this is just part of the conversation. There's much more to have in the future, but I am looking forward to today's conversation. And with that, I'll turn it back to you, Chair, and thank you.
Thank you, Dr. Davila. And now we will review the agenda. So first is items HL 7.1, planning for the 2023 to 2024 respiratory virus season. There's a staff presentation on this item, and there's also a deputation. So I will hold this item down. Item HL 7.2, Toronto Public Health 2024 operating budget submission. There is a staff presentation on this item and a registered speaker, so I will hold this item down as well. Item HL 7.3, Toronto Public Health 2024 to 2033 capital budget and plan submission. There is a presentation on this item, so I will hold this down as well. And item HL 7.4, Toronto Public Health strategic planning. There is a staff presentation on this item, so I will also hold this item down. So we'll go back to the first item. Item HL 7.4, planning for 2023 to 2024 respiratory virus season. So take it away, Dr. Villa. And I see Councillor Bravo is online as well.
Thank you, Chair. And we have some colleagues of mine coming up to the presenters table. This morning's presentation, accompanying report 7.1, planning for the respiratory virus season upcoming. We have Dr. Irene Armstrong, one of our Associate Medical Officers of Health. She's joined at the presenters table by Dr. Michael Finkelstein, one of our Deputy Medical Officers of Health. And with that, I'll turn it over to them.
Good morning. Next slide, please. Thank you for the introduction, Dr. Davila. Protecting residents from communicable diseases has been the cornerstone of public health practice for the last 140 years. Since the early 20th century, Toronto Public Health has used epidemiology, which is the study of the distributions and determinants of disease, to identify ways of decreasing public health risks from infectious diseases, and we've also offered vaccinations free of charge at schools. Each year, Toronto Public Health and organizations around the world use epidemiology to monitor influenza and make predictions about the upcoming flu season based on evidence from the virus strains that are circulating. As more vaccines have become available, TPH vaccination services have expanded to include annual vaccination clinics that provide protective flu vaccine to the citizens of Toronto. In Ontario, Toronto Public Health has participated in, and in some cases led, the Universal Influenza Immunization Program, which started in Ontario in 1999. If you look at this slide, you can see a flu clinic that was on its opening day in 2005, and somebody receiving the flu shot from one of our staff. Next slide, please. This season, Toronto Public Health is monitoring 3 important respiratory diseases, or viruses: COVID-19, influenza, and respiratory syncytial virus, also known as RSV. This slide shows the current activity for COVID-19 and influenza as of the most recent reporting week, which has been October 8th to the 14th. COVID-19 levels started to pick up in mid-August and have built up to a moderate level since then in terms of the percent positivity, the number of cases, and the number of outbreaks. In Toronto, for our most recent reporting week, you can see that the overall COVID-19 risk assessment has remained stable. So we've had similar cases, percent positivity, and outbreaks over the last several weeks. TPH continues to monitor the COVID-19 variants of interest. In Ontario right now, the data shows that the EG 5.1 is the most dominant strain at this time. There is no indication of increased severity amongst any of the currently circulating variants of interest, and the updated XBB COVID-19 vaccine is effective in reducing transmission and severe illness. Moving to influenza, for the 2023-2024 season in Ontario, it has been expected to begin early, similar to what we saw last fall, and also similar to what we saw in the Southern Hemisphere this past summer. So far, though, influenza activity has remained low based on percent positivity of laboratory testing. And we've just seen a very small increase in Toronto in the overall influenza assessment. And we've just really had a very small increase in the number of cases. We haven't seen any outbreaks yet. This year's flu vaccine is expected to be effective at reducing infection and preventing transmission. In Ontario, also, respiratory syncytial virus, or RSV, has also remained very low. We've only had one outbreak so far this season. As influenza and RSV activity continue to increase, or are projected to increase, we do anticipate that severe outcomes associated with respiratory illness and activity will also increase during this season. Next slide, please. As you know, vaccines are the most effective way to prevent any of these respiratory viruses. And this year, we're fortunate to have 3 vaccines available: COVID-19, influenza, and new this year, respiratory syncytial virus vaccine for those who are eligible. It is recommended that everybody who is 6 months of age and older get the updated COVID-19 XBB vaccine this fall. The Ministry of Health is also recommending this year that people receive co-administration of influenza vaccine and COVID vaccine where available. However, the RSV vaccine should not be received within 14 days of another vaccine. And that's just so we can make sure that we monitor for any adverse effects of vaccines like we always do for any vaccine. So if you look at the slide, you can see on the upper left-hand corner that influenza vaccine is available in over 750 pharmacies in Toronto. And of those, 550 of them are also offering the influenza vaccine. Are also offering the COVID vaccine. A flu vaccine is also available through primary care providers, Toronto Public Health clinics until the end of this year when that funding ends, and has already been made available in long-term care homes and hospitals to vaccinate the staff, residents, patients, and caregivers. As I mentioned, this year we have a respiratory syncytial vaccine, which is the ministry has announced has been publicly funded for people that are 60 years of age and older who live in long-term care homes, elder care lodges, and some retirement homes. And that includes retirement homes that are providing elder care services or dementia care services, rather. The COVID-19 vaccine, the new formulation is available. It was approved by Health Canada for both the Moderna and Pfizer XBB vaccines already this fall. And it's now out in all the primary care practices, clinics, and other healthcare settings for high-risk individuals and will be available for the general population beginning October 30th. We also still have the Novavax COVID-19 vaccine, which is the original product, which is the non-mRNA COVID vaccine for those who wish to receive that, and people can book their own appointments to receive that. There has not been an XBB formulation approved yet for this Novavax vaccine, but we are expecting to hear one later this season. Next slide, please. So Toronto Public Health is working across the healthcare system to support outbreak preparedness and response. And we plan to support outbreak responses in long-term care homes, retirement homes, and other congregate settings, such as shelters and group homes, by a number of different ways. We're going to be distributing outbreak preparedness toolkits, and we already have to many of our long-term care homes and retirement homes and other settings, and vaccine and ministry guidance as it becomes available or is updated. We're supporting adherence to best practices in all settings in terms of infection prevention and control. We're supporting and providing guidance for outbreak management, and this includes helping folks implement control measures. We're facilitating laboratory testing, and we're consulting on cases and contacts of people with COVID and other respiratory viruses in outbreak settings. And lastly, we're providing healthcare professionals with information to protect themselves and their patients. Next slide, please. As you're probably familiar with from the last few years of COVID and Dr. Davila referred to, the new IPAC hubs are really an important new support that was established during COVID-19, and they're here to help enhance infection prevention and control and outbreak response. So in Toronto, the models are a little bit different, but in Toronto, the IPAC hubs are based in hospitals, and they include infection prevention and control physicians and infection control practitioners. And TPH staff and representatives from health and community care settings work collaboratively with these IPAC hubs. IPAC hubs are very important for helping build knowledge and expertise in these settings and supporting the development of rigorous infection prevention and control programs. So why are IPAC hubs important? They're important because they provide enhanced infection prevention and control and clinical advice. They enhance system capacity to prevent infections and respond to outbreaks. And they ensure that these settings can better respond to respiratory outbreaks and future infectious disease threats. Next slide, please. TPH has also developed a comprehensive communications plan to ensure that the public and healthcare providers have the information they need to protect themselves and to care for their patients. And this slide outlines very briefly our public education campaign, which is comprehensive, multi-channeled communication strategy that's aligned with the Ontario Ministry of Health guidance. Our campaign is a mix of digital and print media and partnership with community and healthcare partners. We use our partnerships with community and healthcare providers to maximize reach to our diverse audiences. There's 5 main themes for our campaign, and this includes vaccination, preventive measures, what to do when you're sick, where to find COVID-19 rapid antigen tests near you, and COVID-19 treatment. There's also a healthcare worker communication plan, and it includes using our Communique, which is our physician newsletter, and also posting information on our health professionals website. And you can just there see a copy of the creative that we're using in our campaign this year, Fight the Flu and COVID-19, as part of our public campaign. Next slide, please. Toronto Public Health is also collaborating with healthcare partners to make testing and treatment more available to the citizens of Toronto. From a testing perspective, this includes increasing public access to rapid antigen tests, and I saw a bowl of them as I came into this building this morning, which is great, and also communicating testing recommendations. And all this information is available on our COVID-19 testing page, and you may have noticed last week that we updated that page to list the approximately 100 Toronto Public Health libraries where you can access free rapid antigen tests, and we're currently working on an integrated locator map that will soon be posted there. From a therapeutics perspective, we're promoting and amplifying messaging on eligibility and access to drugs for COVID-19 and influenza. Next slide, please. We're also working to continue to enhance access to vaccination. And for our Indigenous strategy, this includes a few things. Toronto Public Health is committed to ongoing partnership and collaboration with Indigenous service providers to address population health priorities as identified by the Indigenous communities. Also, TPH has been working with local Indigenous organizations to prepare for the fall respiratory season, including information sharing and creating temporary influenza or COVID-19 vaccination clinics in partnership with Indigenous organizations. In terms of accessibility, ensuring information about vaccination, treatment, and testing is accessible to all is a very important goal for us. We're also ensuring that we have TPH fixed-site vaccination clinics and mobile vaccination clinics that are accessible with accommodations available upon request. And we have mobile clinics which will focus on our neighborhoods and communities that need it the most, who are at the highest risk, and those that have been the most challenged to access vaccines in the past. Next slide, please. We have also been partnering with school communities to prevent the spread of respiratory illness. And we have a number of programs that include actions that families can take to reduce respiratory virus spread, like getting vaccinated, using masks in crowded indoor settings with poor ventilation, and staying home if you have symptoms. We've been conducting webinars by Toronto Public Health Associate Medical Officers of Health and public health nurses for our school communities. And we've developed a number of curriculum resources and online supports, which include our Healthy Schools Toolkit website and our Respiratory Virus Guidance for Publicly Funded and Independent Schools website. Next slide, please. So this all brings me to our last slide, which is our slide of recommendations. And for our first recommendation, the Medical Officer of Health recommends that the Board of Health requests the Medical Officer of Health to monitor the impacts of the respiratory season on Toronto residents and report back to the Board of Health in January with a situational update if necessary. So we are going to keep our eyes very closely on what's going on, and we'll certainly be coming back as required or needed. In terms of our second recommendation, as you all know, we've been through the worst public health crisis in the last 100 years, and COVID has stayed with us, and we don't expect it to be going anywhere. And there's now new work associated with that, a much larger volume of work associated with that, and many new expectations. And as you have heard, the IPAC hubs have demonstrated that they're invaluable in helping us as an invaluable resource to help us respond to, prevent, and manage outbreaks. So the medical officer recommends that the Board of Health request the Ministry of Health to provide $5.1 million in additional funding for the infection prevention and control hubs to prevent and mitigate the impacts of outbreaks, particularly in long-term care homes and retirement homes and other congregate settings such as shelters and group homes. Thank you.
Thank you, Dr. Armstrong. With that, Chair, we'll turn it back to you.
And thank you very much for that. Before we move into questions from directors, we do have two speakers, public speakers, debutants on this item. Mariko Uday, are you here? She's online, I think. Okay, online. Okay, whenever you're ready. You have 5 minutes to present to the board. Need to unmute your mic, Mariko. You're still muted, we can't hear you.
Okay, can you hear me now?
Yes, we can.
Okay, thank you.
You have 5 minutes.
Hello, Toronto Board of Health. I'm speaking to you today because I believe there are serious adverse events from the mRNA COVID-19 vaccines that aren't as rare as we'd hoped, and that need to be seriously considered before providing to the public, especially those that are young and healthy, with any further COVID-19 mRNA vaccines. I would like to share with you two pieces of information today. The first is a scientific review article in the journal Biomedicines published this year that talks about the variety of adverse events. A quote from this paper is, this paper reviews autoimmune, cardiovascular, neurological, and potential oncological effects. This paper also describes a major mechanism for these adverse events, which explains why they occur all over the body. And this mechanism is that the mRNA, as we know, enters the cell, and then that causes the spike protein to be expressed on the surface, and that's how the antibodies are formed. But if there are some antibodies already there, which happens if you've had a previous bout of COVID or a previous vaccine, then those antibodies will attack that cell, resulting in cell death. And this can lead to severe consequences if in the brain, heart, blood vessels, etc. In addition, the spike protein is pathogenic and the lipid nanoparticle is pro-inflammatory. In its conclusions, the article states, clinicians in all fields of medicine need to be mindful of the varied possible presentations of COVID-19 vaccine-related illness, both acute and chronic, and the worsening of pre-existing conditions that the person may have. We also advocate for the suspension of gene-based COVID-19 vaccines and lipid nanoparticle vaccines. A safer course is to use vaccines with well-tested recombinant protein, attenuated or inactivated virus technologies, of which now there are many for vaccinating against SARS-CoV-2 in the world, but not available in Toronto. I attached the whole letter I attached the whole paper to my letter, which I submitted to your board. The second piece of information I'd like to present to you today is what other countries are doing with respect to offering COVID-19 vaccines this fall. While Toronto is providing vaccines to all age groups starting from 6 months old, Denmark does not provide vaccines to anyone under 65 years old except for people with a chronic disease or condition that increases risks of severe COVID, and a couple of other groups. On its website, it says, why should people under the age of 65 not be vaccinated? And they answer, we know that age is decisive for how sick you can get from COVID. Therefore, as a rule, we do not offer vaccination to people under the age of 65 unless they suffer from a specific chronic disease or have a condition that increases their risk of serious illness. And I attached the link to my letter so you can check for yourself. UK similarly does not offer the COVID vaccine to those under 65, except for those at an increased risk, those living in care homes, frontline workers in the social and health sector, and carers, and those living with the immunocompromised. And I also attached the link where you can check that and get more details on the UK. In closing, given the serious adverse events that can occur, there needs to be consideration of them. The approach being taken in North America seems to be that the vaccines are safe and effective and that side effects are so rare that they need not be taken into consideration. Some European countries, two of which I mentioned, seem to be doing a cost-benefit analysis and curbing their vaccine offers. Given the scientific evidence accumulating on mRNA vaccines, to see an outright suspension of these vaccines until these matters can be looked into further. However, not offering the COVID mRNA vaccines to the young and healthy, as is done in Denmark and UK, would be a small step in the right direction. Thank you.
Okay, thank you. Any questions for the deputant? Seeing none, thank you for coming in today. Our next speaker is Derek Moran. Are you with us? Here we go. He's in the room. Do you mind just stepping aside for a few minutes? 5 minutes to be exact. Okay, you have 5 minutes to present to the committee. You may continue or start.
I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied, and doing so is fraud. God bless His Majesty the King, and long live His Majesty the King. Let the record show that I do not consent to the warrantless searches taking place downstairs here at Toronto City Hall. So I just wanted to thank Deputy Mayor Morley for last month's meeting, mentioning the importance that she placed is on data, evidence-based decision-making, and sharing information. And much like the previous speaker, I also have a preprint to share. I believe that's the fancy science lingo for something that's the stage just before it becomes peer-reviewed. So this is from a preprint titled DNA Fragments Detected in Monovalent and Bivalent Pfizer, BioNTech, and Moderna mRNA COVID-19 vaccines from Ontario, Canada. Exploratory dose-response relationship with serious adverse events. In an exploratory analysis, we found preliminary evidence of a dose-response relationship of the amount of DNA per dose and the frequency of serious adverse events. Conclusion, these data demonstrate the presence of billions to hundreds of billions of DNA molecules per dose in these vaccines. Now, this is from an article by Matthew Horwood of the Epoch Times about this same preprint. Health Canada confirms undisclosed presence of DNA sequence in Pfizer shot. The health regulator says Pfizer did not disclose the presence of the SV40 simian virus 40 DNA sequence in its mRNA COVID-19 vaccine at the time of filing. Angus Dalgleish, a professor of oncology at St. George's Hospital Medical School in London, recently wrote in The Conservative Woman about a higher incidence of cancers following COVID-19 vaccination seen by himself and his colleagues, including an epidemic of explosive cancers with multiple metastatic spread. Dr. Jancy Lindsay, who holds a PhD in biochemistry and molecular biology from the University of Texas Graduate School of Biomedical Sciences, told the Epoch Times that if the SV40 promoters were integrated into the human genome in a process known as insertional mutagenesis, that would then result in gene mutations that could cause cancers. Dr. Lindsay questioned why Pfizer failed to disclose the SV40 promoter to regulators like the U.S. Food and Drug Administration, the European Medicines Agency, and Health Canada. Quote, they hid them. So it's not just the fact that they're there, it's the fact that they were purposefully hidden from the regulators, she said. Both scientists, Kevin McKiernan and Dr. Philip J. Buchholz, have made waves after discovering plasmid DNA in the mRNA COVID-19 injections, warning it could potentially alter the human genome. That's terrific. Another issue Dr. Patrick Provo raised is the contaminating DNA fragments in the vaccines likely being encapsulated in lipid nanoparticles, which could facilitate their delivery into human cells. According to Dr. Provo, the danger of the SV40 enhancers being present in the vaccine is their possible integration into a cell's DNA genome. All it takes is a single integration at the wrong place in a single cell to initiate a cancerous process and kill a person, he said. Dr. Buchholz also said that there are so many experts concerned with the idea of turbo cancers stemming from the COVID-19 vaccine that the scientific establishment owes it to the public to investigate rigorously and report on it. Even if there are negative results, people have a right to have their concerns taken seriously and addressed by competent, caring scientists, even if their concerns end up being invalidated. We should look for monsters under the bed and report results honestly, he added. Now, about that, this was from Harvard College versus Canada, Commissioner of Patents, 2002, where the Supreme Court of Canada said, modification or mutation of even a single gene can have colossal consequences. It is instructive, for example, to note the description of Tay-Sachs disease mentioned earlier, which results in infantile deaths from the mutation of but a single gene. And this is from Ryan Roca from Global News. With more than 90% of the public and 99% of city staff now with at least 2 doses of vaccine, the science and public health guidance no longer supports the need for a mandatory vaccine policy.
Final thoughts,
that was
please.
a quote from former interim city manager Tracy Cook. But at no point was there any science given to back that up. It's just arbitrary decisions being made here by Dr. Davila and the Board of Health.
Yeah, thank you so much. Any questions to the Deputy?
You're welcome.
Okay, see none, thank you. Okay, Dr. Finkelstein and Dr. Armstrong make the return to the table. And while you're settling up, just to let you know that Director Krishner is online and Deputy Mayor Malik is now here with us. Thank you. Any questions to on the presentation from members, directors? I don't know why I'm having a brain fart today. I knew that. Director Chandrabalan, go ahead.
Thank you. Through you, Chair. I was just wondering, in terms of the long-term care preparedness and when they do deem an outbreak, you talked about the preparedness toolkits. What are in these toolkits? What is it that we're providing these long-term cares homes?
Oh, thank you very much. I might turn this over to Dr. Alexa Cadaret because it was her team that actually did the work to put the toolkits together.
Gladly, and through the chair. So the toolkit consists of a number of resources, including educational material and some tools that enable people to better fill out things like line lists, as well as like a set of in-person or online sessions with our staff and with the IPAC hubs that sets up the homes to be prepared to respond to an outbreak should one occur.
So this is done proactively, if I'm understanding correctly? So it's not after they've called and reported an outbreak?
That's
before.
correct.
Okay. And I just had one last question. You had talked about not giving vaccines together because of just being able to monitor adverse effects, but then we had the campaign that said the COVID-19 and the flu vaccine can be given together. Do you know the reason for that?
Yes. So as you'll remember, when the COVID vaccine first came out, the recommendation was not to be giving it with other vaccines, and that they had timeframes between that. And that was so that if somebody came forward with some illness or adverse event or something that happened after the vaccine, there was not a confusion about, is it due to this vaccine or is it due to that vaccine? You'd know that that person only had that COVID vaccine in a particular period of time. And then we gather a lot of information as part of the adverse AFIS, adverse events following immunization process, and we would be able to send that off to be scientifically studied to look and see whether they felt that there was just a causal relationship or not. So now we've had many millions of doses of COVID vaccine, millions and millions of doses of COVID vaccine, and very, very close adverse event monitoring that's taken place. And now the scientists and experts have deemed that it is safe to provide at the same time as other vaccines based on that. But now the RSV vaccine is new, so we want to have that separation in time. So should someone come forward with an illness or something following that vaccine, it would be clear that we don't have another vaccine in the mix that we have to worry about if that may have been associated with these outcomes or not. I hope that's helpful.
Understood. Thank you.
Thank you.
Okay, thank you, Dr. Chandrabalan. Deputy Mayor Morley.
Thank you, Mr. Chair, through you. Thank you for the work that you're doing. I just wanted to pick up a little bit on some of the pieces we've heard from the deputants. Part of the work that I did previous to coming to office was vaccine engagement as part of Team Toronto out in Etobicoke. And I know that hesitancy and the ongoing sort of rapid nature that both vaccines have been developed as well as the information available has been, continues to be a source of conversation and concern for some members of the community. And so I just wondered if you could talk to us a little bit more about how we have monitored and communicated adverse effects. I know you mentioned, there's a process there. So if you could highlight a little bit more about that. And then any sort of additional pieces of information that may be helpful to folks, in the community who still have some hesitancy or concern around the safety and efficacy of the vaccines. As you mentioned, millions and millions of doses have been administered. And I think, there's certainly good evidence there around those pieces. So I just wanted to give you an opportunity to respond on that.
Thank you for your question. I think that although the COVID vaccine technology was new in terms of providing vaccines, that technology has been in the process for, probably the better part of several decades of people trying to build the technology and use the technology. So although it's a new vaccine for us, it was not a new idea or a new technology that was just developed yesterday or a year ago or 5 years ago. It's been in the works for a couple of decades under rigorous scientific investigation. So, when we follow vaccine advice in Canada, we look to a number of different bodies, but in particular, we look to the National Advisory Committee on Immunization, which is a group of scientists and ethicists and physicians and different people who come together to review all the evidence and to make the best practice guidelines and recommendations for us. And we also work very closely with the Advisory Committee on Immunization Practices in the United States, which also has a big body of all these different folks, and then also with the European groups and so forth. So there are the sort of the best minds looking at all the evidence and bringing things together to make the recommendations for us. In terms of speaking to adverse events following immunization, I wonder if I might turn that question over to Dr. Lamptey, as it's her team that is actually responsible for doing all the follow-up for adverse events following immunization, and she could give you a much more detailed answer than I can provide.
Through you, Mr. Chair, to follow up. So I'll pick up from my colleague, Dr. Armstrong, that similarly, just as she reported that when we make recommendations for Canadians, there are many bodies and connections with international bodies on recommendations. The adverse event following immunizations is also a system that takes in information from the local level, goes up to the provincial and nationally. And you may recall earlier this year we presented about how anyone can report an adverse event following immunization into the public health unit. Their family physician can also do it. And our teams look at those. They may contact the person who's reporting the incident to get more information that then goes on to a provincial body called Public Health Ontario that compiles all the adverse events following immunization. So anyone can go online and see how often these occur for any kind of vaccine, including COVID, and what kinds of adverse events people usually report. That also gets reported into national bodies that look at this to help inform recommendations on vaccine use and to assure their safety. So this is a continual process. It's not as if the safety monitoring stops once a product is on the market. Everyone can play a role in making sure that vaccines continue to offer benefit for Canadian residents.
That's really helpful, thank you. And just a really quick follow-up for sort of tangible, for folks who might be curious, how do they report in? Is it called directly to public health? You mentioned they can call to their service provider. So, you know, again, we know that the vaccines are safe and they're the best way to go, but there are folks who might have some bruising or might have some, you know, very mild effects that they might not otherwise report in, but it's still obviously, as you say, the continual improvement, continual monitoring. We want to encourage people to share that information when it is available. So could you just confirm the best way to report that in?
Sure, absolutely. So through you again, Mr. Chair. First, if someone is feeling ill or unwell and it's serious or unusual, they should check in with their primary care provider because there may need to be some medical intervention that needs to happen. So the first place is if it's serious or unusual, they should go and see their family doctor who can fill out a form that comes into public health to report that adverse event. Or if someone wants to report their own, if you go to our website and Google adverse events following immunization or AFI, you'll be able to see a link to how you can call in to be able to report an adverse event. They'll probably, the team will speak to the individual and through discussion with them, fill out a form, then gets sent on to the other levels, as I mentioned.
That's very helpful. Thank you.
Thank you. Deputy Mayor Malik.
Thank you very much, and thank you for the presentation and the information. I was really happy to see the report's strong focus on equity considerations, an area that Toronto Public Health has been a leader in many years, and particularly on this issue. And I just wanted to hear a little bit more about whether we're seeing new strategies implemented this year, or is this a continuation of previously established standards? What are some of the lessons that we've learned and are bringing forward?
So perhaps, Mr. Chair, why don't I address that question, and thank you for it. I think what you're seeing in our plan is certainly a reflection of lessons learned over the course of the last 3 years. We have a number of different methods and improvements, if you will, that are incorporated in our clinical activities as a result of having had the experience of the last 3 years. So for example, when it comes to our mobile clinics, you'll recall in the presentation that Dr. Armstrong talked about how we're providing those vaccines and directing those clinic efforts in the areas where they are most needed and where they can provide the greatest value. So whether it's through our shelter system, through our naturally occurring retirement communities, and right now, given the current context, we know that there are organizations where there are, for example, asylum seekers, and the needs are quite high. So, you know, within the context of the available resources, we are absolutely directing our resources to those areas. As well, you'll have heard, and you will hear later in one of the later presentations, we've actually had a number of conversations with community organizations that serve populations that traditionally have had challenges with respect to accessing healthcare, including vaccinations. And they are actively partnering with us to make sure that people are aware of, you know, the benefits of vaccination and where those vaccinations are available. So those are just a few examples, but certainly I think what I hope you see and what I hope the rest of the board sees is that it's a constant improvement exercise. We learn from the experiences year from year and try to incorporate the best in order to meet the needs as they change.
Okay, thank you. Councillor Thompson.
Thank you very much, Mr. Chair, and good morning, everyone, and Dr. Armstrong, and thank you for your presentation. I guess my question, Mr. Chair, can you hear me okay?
Yes, we can hear you.
Okay, great. Thank you. I guess my question is through to Dr. Davila. Dr. Davila, and we've heard as part of the presentation and some of the comments have been made by the speakers this morning, what is the percentage differential with respect to the risk associated with COVID vaccine and that of any other vaccine and or drugs that are new in the marketplace? Is there a significant percentage increase in terms of the impact of COVID versus other types of vaccines and or drugs?
So through the chair, I don't know that I can provide a very specific percentage, but what I can say is that we know that, as Dr. Armstrong indicated, and as all the members of the board know, the COVID-19 vaccine has been administered to millions and millions of people all around the world. And with that in mind, it is actually probably one of the most studied and scrutinized vaccines ever in human history and in medical history. So there is, as you heard from Dr. Lamptey, a system, a well-developed system, and one that continues. It's not just one that was present for the most acute phase, if you will, of the COVID vaccination campaign. It's something that's been around for many years and something that will continue. So there is a well-developed system by which to report adverse events following immunization, and this is something that we take seriously. I think, yes, as public health practitioners, but I would say that our clinical partners are also attuned to this and are interested in making sure that we are, as a scientific community, observing, recording, and responding as best as possible. So I hope, Councillor, that answers at least in part your question, and perhaps what I might do is offline, we can look into specific numbers to see what is available.
Fair enough. Then can you help me to understand a little bit further on this, the aspect of long COVID? I have spoken with a number of people recently who are I guess, concern, obviously, the impact that it's having on them. And they believe that not enough information is being provided to the public at large. And I wondered whether or not you could comment on that.
So through the chair, thanks for the question. And you're right, long COVID or post-COVID-19 syndrome is certainly something that we as public health practitioners are observing, as it is a condition that has an impact on the health of the population. I would dare say that our clinical partners are probably a little more engaged in it, as this is usually how it presents. People present with symptoms that are not resolving and that in many cases are quite impactful in terms of their daily lives. I would say this, Councillor, this is still very much emerging knowledge. I don't know that there is a very clear and complete understanding, given that COVID-19 really has only been on our radar, if you will, since early 2020. And it does take some time to actually appreciate and understand, to receive reports in respect of post-COVID-19 syndrome, and to actually characterize what that looks like, what the course looks like, and what interventions may actually work. But we do know that there's a more and more in the scientific literature and in the medical literature that's being produced as we hear more about these cases, and it tells us a little bit about how significant infection the virus itself can be. Dr. Finkelstein, Dr. Armstrong, I don't know if you have anything you'd like to add.
Yeah, through the chair, just to reinforce Dr. DeVilla's point, is that there are a number of grant application processes out from national granting agencies to try to build that scientific knowledge. So we have seen the response from our national bodies like CHR and others to provide resources so clinicians can build the knowledge that Dr. DeVilla said was required in this area.
Thank you very much. And then my final question through to you, through Mr. Chair, through to Dr. DeVilla. The hesitancy of the vaccine is obviously still alive and well. I'm just wondering whether or not the continued practice and approach that we took through the previous process with COVID in terms of eliciting stakeholders and partners and community organization and so on, whether or not that will be still part of the process and approach that will be taken in terms of going forward. Thank you.
So briefly through the chair, the short answer is yes. I would also say this board will remember that in our interactions in the past, as we talk about things like vaccine confidence and hesitancy in respect of receiving vaccines, I cannot overstate the importance of actually having a trusted relationship with a provider. Vaccine happens at it's an interaction, it's a clinical interaction, and it is incredibly important. And we would encourage people to actually have the conversation with a trusted provider who's aware of your circumstances and understands your whole life. We speak here at this table at a population level largely. And we know, we have seen the remarkable benefits, yes, of the COVID-19 vaccine, but as well as of other vaccines that prevent very significant diseases. I think that we've been quite fortunate in a country like Canada that we have such good immunization practices that we don't generally see how significant the harms of actual vaccine preventable diseases are and how much these vaccines actually provide us in terms of benefit. Other countries around the world, less resourced environments, unfortunately do see the impact of diseases like measles and other vaccine preventable diseases. We're certainly interested in ensuring that we keep our vaccination levels high and continue to receive the benefit of the protective benefit of vaccines. And yes, this includes the COVID-19 vaccine.
Okay, thank you. Any other questions, staff? Director Zhao, go ahead.
Great, thank you for your presentation. I was just wondering about what are your predictions on what the flu and COVID season is going to look like this year compared to last year? Do we have any early signs that this year it might be even worse given the vaccine hesitancy?
This is always a tough one because people do sort of do modeling and make predictions. But, you know, it's a bit of a crystal ball kind of event because you never really know. Before COVID, I was the flu lead, and I would often get asked this question, what kind of a flu season are we going to see? Is it going to be lots of cases? What's going to be the predominant circulating strain? And to be honest, we can look to the Southern Hemisphere to try and help us, and we can look to the global epidemiology to try and help us, but it's really hard to say for sure. So I just wanted to preface my comments with that. I think that many of the experts feel that at some point, COVID will probably become a regular circulating virus that's going to be part of like the fall and winter respiratory virus season, but we're certainly not there yet. And I think a lot of experts seem to think it'll take a few years to probably get to that point. This year, as I mentioned, we've been in a recent wave that started around mid-August and has sort of gone up to sort of a moderate level over the last few weeks in terms of percent positivity cases and outbreaks. And if you look at our outbreak list, you can see that the vast majority of the respiratory outbreaks we're experiencing in our healthcare settings are due to COVID-19 virus. We have a little bit of an indication right now at the provincial level, it's a very early indication, that we might sort of be leveling off a little bit provincially. But regardless of where we are, it is expected that we are going to have another winter wave of COVID-19. And we do see that people have some immunity both from vaccination and from infection. And we see that we have a good updated XBB vaccine that looks to provide good protection to people in terms of severe illness and so forth. In terms of influenza, again, pre-COVID, like sometimes we have very high levels of flu season, sometimes we have lower levels. Certainly we saw a lot of influenza activity last year. And when we look to the Southern Hemisphere this year, and because they have their winter season in the summer, so that's when their respiratory viruses are circulating, we saw that they did have an early start to their flu epidemic level or wave. And we saw that children under 15 were predominantly affected by that. So, when we look at what kinds of different kinds of strains of flu that are circulating, it seems that there hasn't been a big drift or big change. And so we expect that there might be something similar here. And when we look at the vaccine that they used, it was actually quite effective, and it's the same vaccine we're using, so we hope that will be effective too. So I guess all this to say that we do expect to see increased levels, especially since we didn't have any flu circulating for several years, so people have less immunity and so forth. But it's very difficult to say exactly what to expect. But I think when you look at the very high levels from COVID, even when we're at our lower levels, we're still seeing lots of COVID outbreaks. When we look at expecting RSV to take off and expecting influenza to take off, along with all the other myriad of respiratory viruses, we do expect that we could have a fairly busy season.
Thank you. And just a question that patients have been asking me is, do you ever know there will be one vaccine that combines the COVID and flu together instead of getting two vaccines?
I'm not really up to date on the research, but I have been hearing, through just reading and so forth, that there are pharmaceutical companies that are looking at combining those two, but I'm not familiar with the details of that. I don't know if any of my colleagues around the table are.
So if I can, Mr. Chair, I think that is still very much, it's of interest. How likely it will be, I think will depend on how successful the efforts are in the lab.
Thank you. And Trustee Sriskanarajan?
Thank you, through you, Mr. Chair. So I see that the RSV vaccine is for 6 years plus, but being in the toddler mom circles, I know that RSV is a really probably the thing parents fear more than the flu or COVID. So is there a rationale for why we are or not being funded for younger children to get the vaccine, or is it just an economic issue, or is it efficacy? What is the rationale?
So the particular RSV vaccine that is now been publicly funded by the Ministry of Health in Ontario for people 60 years of age and older was only studied in people 60 years of age and older. So they're not going to be expanding that eligibility beyond that. And in fact, this year, we still are waiting for our National Advisory Committee statement on immunization regarding the RSV vaccine that hopefully we'll expect soon. There are vaccines in the works for the pediatric population, but they are not at the point yet where they've been brought to Health Canada to be considered for approvals. There is still a treatment for young children that are at increased risk, monoclonal antibody that's available through the ministry for certain populations at increased risk that are pediatric.
Thank you. That's really helpful. And my last question, and I appreciate Deputy Mayor Malik asking the question about equity. So I'm happy that was asked. But my last question, just to what the speaker said, one of the speakers, and that sort of, and we've heard this throughout the vaccine campaigns about the hesitancies against getting specifically an MRA vaccine, and that they mentioned that other countries have alternative vaccines. And this might be a question that's beyond you to answer, but is there any movement to sort of procure alternative vaccines so people who are hesitant can still be protected against COVID?
I'm not sure what you mean by alternative vaccines. Like, are you referring to the non-mRNA?
Yes.
Oh, yes. Okay, got it. So yes, there is the Novavax vaccine. That is the only vaccine licensed in Canada that's not an mRNA technology. It's a standard vaccination technology. And that vaccine is available at our Toronto Public Health clinics to people who want to receive that. And they can just call up and make an appointment. They don't need to go through a healthcare provider to do that. That vaccine right now is the original formulation of the different COVID strains. And my understanding is that Novavax has developed an XBB vaccine, but I don't believe that they've applied for Health Canada approvals just yet, although I think it may be available in the United States. So we're waiting for that to be, presented to Health Canada for approval, and they'll do their usual scientific review process to look at it. And we're anticipating that probably that Novavax XBB vaccine will probably become available later this respiratory season. But right now there is the original bivalent vaccine available.
Thank you. That's really helpful, especially as the speakers mentioned. Clearly, there's a lot of misinformation circulating, so that there is an alternative for those.
Yes, yeah, and it's easy to for people to make an appointment to get it.
Perfect. Thank you.
Thank you very much. Any other speakers?
Mr. Chair, I have a couple of questions.
Okay, 1 second. Thank you, Councillor Bravo. I'm going to ask the Director Ozode to go first, and then Councillor Bravo.
Okay, thank you.
Thank you all so much for the presentation, and I just want to echo Dr. Eileen de Villavan about the lower resource settings that have, that you can see the impact of vaccines. I grew up in one of those in Nigeria, as we may all know. I grew up in a time when polio was a thing, smallpox has just been eradicated, but even till now, tuberculosis, is still a thing. So these questions are really important and necessary, but I just wanted us to keep that in perspective. But my question really is about shelters. And so I live in Etobicoke North, and I'm sure we all heard about the refugee situation there earlier in summer by the Pilgrim Feast Harvest Tabernacles. It's a non-for-profit faith-based organization. And right now they're hosting a temporary shelter for refugees. a restaurant, a basement church, and even an old TD bank and some old offices have been converted to shelters. I was there last week. I went on a tour, and just the conditions that these people are living in is incredibly demoralizing. You know, you couldn't believe it was a place in Canada if you've seen the pictures. In summer, there were 150 refugees, and that was when the situation was still supposed to be temporary. Now there's nearly 300 refugees, and it's going to continue, throughout winter. It's incredibly crowded, bunk beds everywhere. Again, living conditions are really heart-wrenching. And I spoke to some of the staff there, and the conclusion that I got to was that it is a politically muddy water. Met a doula who took care of some pregnant women who were there. And so, given this particular context, I have some questions. And the first one is this now a recognized shelter in the city? And if that's the case, what plans does public health have to prevent any outbreak in this shelter, given the conditions?
So through the chair, thank you for raising this issue. When it comes to shelters and specifics around, what is recognized in the system and who is coordinating, we'll have to leave that to our colleagues at the Shelter Support and Housing Administration. However, what we can say in respect of health services, including those that are provided by public health, there is there are several tables actually, but there is certainly a table where healthcare providers and health system partners are actually working together to provide necessary supports. So as you know, as public health, we're not really the lead in respect of clinicians. You talked about, availability of services of a doula or perhaps midwifery or other maternal care for those who are expecting. You'll see that those are clearly within the realm of clinical providers, and we know that our Ontario Health Partners, Toronto region, has access to different resources and is able to bring healthcare partners who can address those clinical services to bear. They do bring different partners and discuss who's best positioned to provide clinical support. From a public health perspective, we do have some services that we're able to provide. Certainly, you're quite right when it comes to when we're aware of settings and we're asked to provide support from an infection prevention and control point of view, we are able to provide some support and some advice. And when it comes to other services that we provide, we have some programs, for example, in respect of supporting new mothers and young infants. We have some programs, of course, to provide to ensure that vaccine is made available, particularly as we enter the viral respiratory season. These are the kinds of services that we're able to provide from a public health perspective. But, I would suggest in respect of a specific shelter, it might be best if we discussed offline and had some conversation with our partners at Shelter Support and Housing Administration.
Okay.
Thank you.
Okay, thank you. And Councillor Bravo?
Thank you, Chair. I am at home with one of these viruses, so I apologize. I have just a couple of questions through you. Could you just want to ask staff to share more about the 2023-2024 respiratory virus communications plan? Just thinking about people who may not have access to the internet and about how public health might be reaching them.
So through the chair, we have a number of different elements to the communications plan. You're quite right. There are some elements, and a significant number of our products are made available through online channels and social media channels, but certainly we do use print media, and I would also suggest that one of the elements that Dr. Armstrong spoke to was also our partnership with healthcare providers and other community agencies throughout the city. So we do try to use a series of different channels, some of which are more electronic, and others of which are perhaps a little more traditional, I think would be the word that I would use to describe, to try to get to all the pockets and corners throughout our community.
Thanks. I assume that through our community partners as well.
Yes, yes, absolutely.
My second and last question is, I'm concerned about, and as are many, about the impact of indoor air quality on respiratory virus spread, especially in settings like schools, daycares, and workplaces. Is it, within resources, is this something that Toronto Public Health could do or does? And is that question about quality a point of analysis or something that we look into when an outbreak is found?
So through the chair, to go to the general statement, when it comes to indoor air quality, particularly in the schools, we know our education partners have taken on a number of different interventions and instituted a number of different protections. It's my understanding, again, this is done largely under education, or actually exclusively under education. They have, as I understand it, updated HVAC systems within schools where that's doable, and have provided filters in those areas, HEPA filters, where HVAC upgrades are simply not possible. I understand that there are some buildings that are just, where the HVAC system is perhaps a little older and doesn't lend itself to some of the more modern changes that can be made in the short term. Hence, they use a little combination of filters. Sometimes it's about opening windows, and sometimes it's about actually making HVAC changes. When it comes to workplaces, I understand that there's a lot of work happening around HVAC experts. They are updating and reviewing building standards. I've had some opportunity to speak from time to time with colleagues at the Ministry of Labour, those who are more responsible for occupational health concerns, as many of these buildings are indeed workplaces. So standards are getting updated. It is not an area in which we are directly involved as a local public health unit, but we certainly do talk to provincial partners. Our colleagues at Public Health Ontario have been working on some advice in respect of ventilation and indoor air quality, as I know other researchers are working on as well. So, Council, I hope that addresses the question for now, but I will say that it's not something that we directly engage in as a local public health unit.
Thank you.
Okay. Thank you.
Sorry, just to be clear, you have not been requested or mandated by, and there's no provincial sort of strategy to ask this local public health authorities.
So at this point, with respect to requests made of local public health units, it's not reflected in the standards. I do note one thing though, Councillor, you did mention something in respect of outbreaks and how we do, how we might engage in that. We know, and I can think of very specific outbreak investigations where we do look at ventilation standards. That is part of an outbreak investigation. And when things like maintenance of the HVAC system are the kinds of advice that I know we've provided within the context of outbreak investigations. And as I think about the kinds of tools that we have talked about in the toolkits for long-term care settings and other congregate living settings, ensuring that those services and those systems are well maintained is part and parcel of a preventive strategy when it comes to outbreak prevention and control.
Okay. Thank you. And I think we've exhausted all the speakers' questions here. Any speakers on this item? No? Okay, that's good. I will speak to this item then, since I didn't ask any questions. I just want to thank staff and thank my colleagues for asking some comprehensive questions on this issue. The questions I was going to ask actually is around equity. I'm very concerned about long-term care homes retirement homes, and of course, congregated sites, most specifically our shelter system. We know those are the people that are most vulnerable in our communities, and we need to be mindful to make sure that they are supported and taken care of. And so I'm really happy to hear that outreach is taking place to make sure that we vaccinate as many people as possible. And the motions that are brought forth here, recommendations by staff, especially item 2, specifically asking for $5.1 million annual funding from the province in regards to infection prevention and control, is really important. Again, we come through this every year, right? We do this time and time again, and usually the city always dips into its funding to top up some of these issues and problems that continue to arise. So I hope our motion here asking the province to actually step up and provide this ongoing funding to our community. They will hear us and send the money, among other requests that we've made to them. But again, thank you to staff, and I hope that we will go through this season of influenza and COVID, in a seamless way that, and it won't be as traumatic as it has been in the past. So with that being said, I'm going to move staff's recommendation. All those in favor of moving staff's recommendation? All those opposed? Carried. Thank you. Okay, the next item is item HL 7.2. And I'm also going to move HL 7.3 together. Toronto Public Health 2024 operating budget submission, and HL 7.3, Toronto Public Health 2024-2023 capital budget and plan submission. So staff do have a presentation on this item, and they're going to combine the two, I believe, right? Okay, Aretha, do your thing.
Good morning, everyone. Just waiting for the slides to come up. It's a pleasure to be in front of the Board of Health yet again, talking about one of my favorite topics, money. I'm sure yours as well. So next slide, please. So I'm going to be going over sort of 3 things today, in particular our capital budget and plan for 2024 to 2033. I'll be also going over the 2024 operating budget submission, which has been made to the city, along with some recommendations that were put forward in our report, and a subsequent recommendation that was made by the Board of Health Budget Committee. And finally, I'll be doing just a really quick recap on the 2024 service levels. Next slide, please. So in terms of our capital plan, I mentioned that it's a capital budget and plan. The budget is for the very first particular fiscal year, and this year we're asking for $5.8 million for our 2024 budget, predominantly for IT projects as well as some renovations that we're doing in the dental clinics. And then for the total capital budget and plan, which is a 10-year time frame, we're asking for $23.7 million. Next slide, please. So this is the details on the particular projects that we're asking for. As I indicated, there are 3 IT projects and there are 4 dental. One of them is our inspections management implementation project. And that program, what we do is we do, quite a few inspections in terms of food safety, in terms of personal service settings. So the capital item that we have, or the IT project that we currently have right now, has reached its end of life. And so we're busy trying to ensure that we have a system that's going to be there to bring us forward. The next one is more of a technical update. We have a system that we use. It's called the Toronto Community Health Information System. And what we actually do with that is that part of that is we gather data from our staff going out and doing particular work in the community, and we like to actually map it. So we're in a process about just updating the technology that's behind that. The next slide, please. And another, actually quite an exciting project for us is the electronic medical records. And that project we started it prior to COVID. We had to put it on the shelf so that we could deal with our COVID-19 response. But we are bringing it back, and we're hoping to have this kind of wrapped up in the next fiscal year. And it's going to be implemented, as it indicates here, in our sexual health clinics, as well as our needle exchange. And we're also looking to see where this new IT system can be used elsewhere within the organization. And finally, we have our our Ontario Seniors Dental Care Program. And there we are looking to, in some cases, we're building out our own clinics, we're renovating our own, and in others, we are partnering with other individuals engaged in this space, particularly CHCs or community health centers, in order for us to build up capacity so we're able to meet the needs of the Ontario seniors in terms of their dental care program. Next slide, please. I'm going to turn over to the operating budget. And one of the things I like to present every single year is what I call, it's a continuity schedule. And what this schedule does, it does provide you in detail to what our approved budget was, from the previous year, and what our new budget is that we're putting forward for submission to the city's budget process. Typically, what we would do is we would just, we wouldn't necessarily restate our operating budget, but because we have such a significant amount of our budget is actually COVID-19. In the report, there are two presentations. There's one table that kind of gives you the overall, exactly what was approved by the city to what we're putting forward. But this is the alternative approach I like to present. So you get a true picture of what our true year over year would look like in the absence of COVID-19, which, even though it was quite long, it is an episodic. It started out as an episodic. Of course, it continues on, but not to the same magnitude nor degree. So what you see here is you see the opening amount that was approved at City Council in February, and then you see some incremental changes that happened throughout the year. We got some good news from the ministry where they said they were going to provide us with a 1% increase that amounts to roughly $1 million in revenues. We also, we have an IOT program, Injectable Opioid Agnostic Treatment Program, which is funded through the federal government. They rejigged some cash flow for us, so we were able to put some more additional funding into the budget for 2023. We also got some additional funding from the city for salary and benefits. So there's just incremental changes for particularly non-union staff. And then, of course, you see all the COVID-19 items that we're taking out to bring us to a restated starting price for 2023. And in terms of COVID, we had the Toronto Voluntary Isolation Center, which wrapped up in March. We also had the COVID-19 School Focused Nurses Initiative that wrapped up at the end of the school year in June. And then we have the COVID-19 response and vaccination campaigns, which I think previous speakers have already mentioned that the funding for that does come to an end in December 2023. So what we have here is we've got a new sort of starting point for our 2023 budget in order for us to compare what our budget submission will look like. Next slide, please. So in terms of, what are we putting forward? We are getting some additional funding from the ministry as they confirmed with us after their announcement on August 22nd. And so that amounts to $1.3 million. It's a 1% increase. And we also, every single year, we put forward a request for the cost of food increase for the student nutrition program. This year, we have used 8.5%, which was the year-over-year change in the inflationary costs for food for Ontario from July of 2022 to 2023. And finally, we have we've got some salary and benefits. That, of course, is linked to all the permanent staff within TPH. And then we have some technical adjustments as well that that's impacting our budget. The majority of that is related to our capital projects, and these are capital projects that we thought were going to be happening, and they were linked to the work that the province had wanted to do on one of our old and antiquated systems called IFAS, and they have actually, IFAS/Panorama, and they've actually put that on hold as the province is going to take a look at their entire technology portfolio. So we're taking out those dollars as well as those positions because predominantly that project is not moving forward. And so what that gets you is you'll see that we are looking for, on a gross basis, it's about $6 million. And then on a net basis, and a net just basically means this is what we're asking the city in particular to provide through their the tax. And over year, we're asking for an 8.4% increase to our funding. Next slide, please. So I wanted to highlight two recommendations that were in the report that was presented to the Board of Health Budget Committee. In particular, these ones are not reflected in our budget that I just went over, our continuity schedule, but they are still funding that we're looking for. And in one, we're looking for funding from the province for a new vaccination distribution service to the tune of $300,000. That particular program, that is a new body of work that has been, that we've been asked to do. We have never been engaged in this work before. It's for COVID-19. Up and even as far back as, history within Toronto Public Health exists, this work has always been done by the province as far back as pre-amalgamation. The other one that I want to highlight for you because it's not included in the continuity schedule, but it is in the report, is that we continue to have an opioid poisoning crisis within the city of Toronto, and we've asked for two things. One, we do receive funding from the province for our supervised injection services, which are located at 277 Victoria. That funding, when it first came, we got $1.2 million, and then a little bit later on, because we had to increase the amount of security that we had on site, we got an additional $400,000. So our total budget is 1.6, but it's been static at 1.6 for at least since 2019, which is when we got the additional 400,000. So what we're doing is we're asking for the province to, at the very least, index the costs associated with that particular program to inflation, because we do have, cost increases that are associated with staff, that are associated with some of the supplies and services that we purchase in order to run this particular program. And beyond that, generally speaking, what we are finding, as I indicated, is that the situation in terms of the opioid crisis, poisoning crisis, is really, I don't think I need to say anything. We've talked about it many, many times here. There's been many presentations to this board. And for that reason, we're actually asking above and beyond providing us with just indexing to inflation, a request for $3.4 million to augment the services that we're providing at Toronto Public Health. And frankly, to support the staff who have been doing this for quite a long time, and bringing in additional staff to augment that work and support the staff along that work. Next slide, please. I'm going to shift gears just a little bit here, and this is one of my, I forget when this was asked of me. I think it might have been 2019, and I bring it back every single year because I think it's a good snapshot for people to take a look at in terms of our cost shared programs with the Ministry of Health. The Ministry of Health is our largest funder. They provide, a significant amount of funding for us. And so what you're seeing here is the blue sections in this chart, they're funding that comes from the Ministry of Health. The green sections in this chart, that's funding that actually comes from the City of Toronto. So you'll notice that in 2020, 2021, and 2022, there's two blues in the blue charts. One is the darker blue would have been our base funding that we have. And then the $14 million or the $14.6 million, that was what they called, one-time mitigation costs that the province had been providing because they had made a change in the 2019 budget where they had indicated they wanted public health units to move to a different cost-sharing model. So that, of course, when the announcement was made in 2020, something happened, starts with a C, ends with a 9. And so, of course, they provided the funding for us so that we would not be, significantly financially impacted. That being said, however, we still did, the budget was flatlined, even though we did get the 14.6. And that's why you'll notice on the green part, you'll notice that the lighter green keeps growing every year because we do see COLA increases predominantly for staff, but also for some of our contracts as well, where it's built in that we have to provide an increase in our contracts. So you'll see that that line represents what the city has been contributing towards Toronto Public Health, and it's cumulative over time to ensure that we just, have a static baseline. So that's just delivering the baseline services. This isn't adding anything new in terms of what we are providing. Can I get you, and sorry, before I move off of this slide, I want to note that there is a little line that goes through that. And what that represents is when you take a look at the cost sharing, what percentage is the province actually providing to Toronto Public Health? So in 2020, we started out with 77.3%. And the reason why it's that high is because really, we didn't always have just cost-shared programs. We had cost-shared programs, and we also had programs that the province actually paid at 100%. So you'll notice over time, the amount that the province is actually contributing towards Toronto Public Health has steadily been decreasing for two reasons. One, because the 100% programs actually became cost-shared, and second, because of the COLA increases or the inflation increases year over year, the city has been contributing. So the city's portion has been increasing while the province's portion has been decreasing. And we landed at 72.4%, which is what we're calculating based upon the budget we're putting forward this year. If I could get you to move to the next slide. I've put a different bar chart at the very end, and that's still 2024. But what this represents here is that if we were actually having a cost-shared program that was 75% from the province, 25% from the city, based upon a budget the budget submission that we're making, in fact, the province would have to increase their funding to the tune of $21.7 million in order for us to achieve, that cost-sharing model of 75-25. So they would be moving from roughly 150 to $175 million. And that's when, that chart represents the province matching the funding that the city is providing or requesting the city provide to Toronto Public Health. Next slide, please. So this is new. I did present this to the Board of Health Budget Committee. That $21.7 million, it's not reflected in the report. What's reflected in the report was just what would happen in 1 year. What would happen with the $6 million increase that we have for 2024, and that's what's on the left-hand side. So that's what's reflected in the report. But in discussions, after the report was written and looking at the numbers, we thought it was important to bring this forward. So the board was fully aware of what a true 75-25% funding model would look like. It was a question that was raised to us, I think, in our September meeting. So I just wanted to make sure that the board had that information available to them. Next slide, please. At the Board of Health Budget Committee, there was a motion that was made, and the motion, of course, addresses that $21.7 million. And basically, the Board of Health Budget Committee was recommending to the full board that we request of the province that they provide the $21.7 million in order for them to achieve a 75-25% municipal funding, which was, linked to the announcement they made on August 22nd in terms of public health funding moving forward. Next slide. Finally, we have our service levels, which I think we had a very long conversation about in a previous board meeting. And I just wanted to reiterate to the board that in terms of making our submission to the city, we'll be putting forward 46 service levels. And there are a few of them, 3 in particular, which it's still under review. 2 of them are linked in our chronic disease and injury prevention. It's under review because of a report from the Auditor General of Ontario. So we are working internally and with other public health units to determine, how we might best reflect our service levels related to that. And also in the family health one, in the course between when I presented earlier and coming back to the board, one of our service levels, which is linked to a particular IT platform, that IT platform has been disabled. It's something that we're purchasing. So we're reviewing how do we either find a different way to report on that particular service, and we will report back to the board at a later date. Next slide. I think that takes me to the end of my presentation.
Thank you. Again. We do have some speakers here, some deputants. First up is Carolyn Egan from Birth Control and Sexual Health Center. Welcome to the Board of Health. You have 5 minutes to present to the committee.
Aisha Adami from the IWHC, the Immigrant Women's Health Center, is actually going to be speaking to the deputation.
Okay. Go ahead.
And we have Leo Matuni also from Hassle Free Clinic with us.
So you're all speaking together?
Aisha will be speaking for us.
Okay.
And then we'll entertain questions together. Thank you.
Whenever you're ready.
Thank you. Just one second. Okay. Thank you so much. Thank you. Thank you and good morning, Chairperson Moyes, Dr. Davila. Good morning to all of you members of the Board of Health. And before I begin, I just want to take a moment and thank you, Dr. Davila, for your tremendous leadership through the COVID-19 pandemic on behalf of all of the clinics and all of the populations that we serve, and for Toronto Public Health's ongoing commitment to equity, inclusion, and access to services for all vulnerable communities. Thank you. Thank you for this opportunity to speak to you about the necessity of sexual health care services for the residents of Toronto. Collectively, we represent the 3 independently operated and Toronto Public Health funded integrated clinics, Birth Control and Sexual Health Center, Hassle Free Clinic, and IWHC Toronto, formerly Immigrant Women's Health Center. Our three clinics are an integral part of Toronto Public Health's sexual health program, with a well-established history of providing safe, responsive, and barrier-free sexual health care access to diverse communities in the heart of Toronto. Our combined demographics include clients of all gender identities, sexual orientations, cultures, ethnicities, and marginalized backgrounds. This is the 3rd time that we are appearing before the Board of Health for a deputation in the last 12 years. We have been here in 2011, in 2019, and now in 2023, based on direct or possible cuts to our funding, and we are taking this opportunity to appeal to you for the stabilization of funding as a critical service provider for healthcare services to our city's most vulnerable and underserved populations. The state of accessible healthcare has changed dramatically through the pandemic. Since 2019, the estimated figure of 144,000 Ontarians without a family physician has skyrocketed to 2.2 million Ontarians as of February 2023. Our clinics routinely see clients from family physicians who do not have the capacity or proficiency to adequately diagnose and treat sexually transmitted infections, better known as STIs. Clients who would attend walk-in clinics or spend hours waiting to be seen in an ER will only be treated pharmaceutically without the vital STI education, prevention, and follow-up that our clinics provide. Factor in the cost of STI patients being seen in hospitals, and there is a significant burden that would be offloaded onto an already battered, understaffed, and under-resourced healthcare system. The result would be countless patients, Ontarians, and uninsured populations remaining untreated, infecting and reinfecting one another, and unknowingly increasing the risk of more serious health outcomes like pelvic inflammatory disease, infertility, neurological illness, blindness, hearing loss, and organ damage. The testing, treatment, prevention, and outreach we provide bolsters Toronto Public Health's efforts to manage and reduce STIs in our cities and combat the rise in syphilis, gonorrhea, and chlamydia, which have been documented as a cross-country trend by the Public Health Agency of Canada since 2006, and identified by Toronto Public Health this year as the highest proportion of cases among all non-pandemic infections from 2017 to 2019. HIV infections continue to increase among men who have sex with men, and as recently as 2019, Dr. Rita Shaheen, Associate Medical Officer of Health here in Toronto, told CBC News that rising rates of STIs are part of a global trend, and she raised the alarm on the surge of antibiotic-resistant gonorrhea, which could decrease national antibiotic supplies while increasing infection transmission rates. Since 1883, Toronto Public Health has upheld a mandate to protect the health of Toronto residents by preventing the spread of disease, promoting healthy living, and advocating for conditions that improve health for Toronto residents. The integrated clinics are an integral part of that service provision. In closing, I'd like to leave you with a few key takeaways. Pre-pandemic, the integrated clinics saw more than 40,000 clients collectively per year. We are well on our way to reestablishing those numbers. Our purchase of service cost for 2023 was approximately $3 million, which is an excellent service value for the city. Our services enable low-income and uninsured clients to access subsidized diagnosis, treatment, and family planning medication for low or no cost. Each of our clinics provides a unique, incomparable, and essential service to disadvantaged and underrepresented populations. We have our work cut out for us, and we ask that you continue to protect and support it. Thank you very much.
Thank you for your deputation. Any questions of the deputants? Deputy Mayor Malik? Deputy Mayor Morley?
Easy to confuse us, right? Thank you, Mr. Chair. Through you to the speaker. Can you point to us, is there a specific decrease in your typically allocated resources for this budget that's before us? And can you describe that in detail?
Okay, we are not aware of any decrease, and we are hoping there will not be one. But because we are very tuned to the political realities of the City of Toronto and its discussions with the province, Ministry of Health, we are raising the concern that this could be something that would be considered within the Toronto Public Health Department. It has never happened in the past that we've always gotten what we've needed. I shouldn't say what we've needed, but what was absolutely the baseline in the past, and that's why we're raising it today. We just wanted to make sure people were well aware. And I think one of the things that also we wanted to bring into play was the fact that we know, and I think many in the Toronto Public Health Department, Dr. Davila and Councillor Moyes and all the rest of you on the Board of Health, we have an absolutely world-class sexual health network in this city that's recognized across this country and I think across North America. It's taken decades and decades for this to become a reality. And of course, it could be better resourced, it could be larger, it could be much more inclusive, but it is what it is. And I think because it took those decades to bring it to fruition, we are so concerned that any diminishing of it at this point or doing away with any of the services, both public health clinics and our own, would take decades and decades again to build up. And the crisis we're fighting, there's so many crises, of course. We just feel it's really important to bring the reality of sexual health before the board, before the councillor, and medical officer of health is very well aware, I'm sure. And that's why we've come today.
That's very helpful. Thank you for the clarification. And I just want to, echo your comments, and was mentioned really succinctly the value and impact of primary care that's accessible in local communities really is critical to alleviate pressure from our wider healthcare system, which we all know is under, significant duress. So very helpful, and I'll follow up some questions of staff as it relates to the conversations with the province on funding.
Thank you.
Thank you.
Thank you. Any other questions, deputants? Councillor Deputy Mayor Malik.
Thank you so much for your presentation. And just building on Deputy Mayor Morley's question and what you shared, the examples of other jurisdictions of the system and the services that are provided around sexual health in Toronto, the strength of that that has been built over decades. Can you share a little bit more with us about such a strong set of services that we had and how that was even more important as we came through a global pandemic? Can you speak to us a little bit about the impacts and supports and how that was able to get us through the last few years in a better way?
Thank you very much, Councillor Malik, for raising that. And as Aisha alluded to, we come up from the communities, we've responded to the demands of communities, and COVID was an extraordinary phenomenon that we all lived through here, and we know that the Public Health Department was incredibly stressed and had to change resources services, do really kinds of reallocation of staff, so that the sexual health clinics that are part of public health, frankly, had to be closed. The Scarborough Clinic, the Jane Street Clinic, the Talk Shop, so many of them that provide excellent service as well, had to be closed because of response to that pandemic. And the three of us, Hassle-Free, IWHC, formerly Immigrant Women's Health Center, and the Birth Control and Sexual Health Center, we serve the northwest quadrant of the city. We stayed open. And this was an extremely difficult thing for our staff, for our physicians, but we did with the support of Toronto Public Health. And we provided all the sexual health needs, if I may say, through that long period of many, many years. And we're happy we're moving out of it, obviously. And all of the Toronto Public Health services are not yet open because of the realities that they're still facing. But our staff was able to do it at great cost. I mean, many of our staff, all of our staff came down with COVID at one juncture or another because we were frontline, direct facing of clients who came every day, many of them who have no status, have no access. Many of them were not vaccinated because fears of vaccination, all of the things that I think you spoke of before. So that was something that we championed, we provided it, and there was not a doubt in any of our boards, because they all discussed that. Would we stop? No, we wouldn't, because sexual health was so important to this city for the vulnerable, high-risk communities that we serve, that we felt it had to be continued.
Thank you very much. Sorry.
Thank you for the question. I just also wanted to add that in the post-pandemic scenario, and given what we just saw around the Toronto Public Health's budget, our funding levels have pretty much remained stable, but that has not caught up with the cost of inflation. And also, the three clinics are now looking at implementing EMR, which is a significant technological and resource-heavy cost for us. And if there were to be any kind of funding cut for us, that would impact what we're able to do and how we're able to do it. And also the requirements, for example, that our clinics need to now uphold in terms of the directive of the ministry to move to an EMR model. So we are having to absorb the cost of those with an already quite taxed budget. So any cuts to that budget would impact the way that we operate.
I just have one more question. Thank you for sharing that and alerting us of the implications of any changes to your budget. I'd like to also just hear a little bit more. You touched on it, but how we had a few questions earlier about equity and how that is reflected in the way that services are provided. I know that you're able to reach diverse communities that are often missed by government services. Can you speak to us a little bit more about how you are able to deliver those services that are really essential, preventative, and much needed through the three clinics that you're representing?
Thank you. I'll speak for IWHC Toronto, which has from the beginning been a clinic that provides services that are culturally sensitive, religious appropriate to communities and the religions that people represent. It's language. We have multiple languages that we serve. I'll let Carolyn and Leo speak to their clinics. And just to piggyback on what Dr. Davila also shared, the importance of building trust in communities and having those relationships. We have over 50 partnerships with community organizations throughout the city. We pioneered the mobile health clinic program that delivered sexual health clinics to communities all over the city of Toronto through those community organizations and partnerships. That program has since been retired. However, we use those relationships still to give access to information, access to services, to get into the communities where people are, let's face it, untrusting of the medical establishment. They've not had good experiences. They don't feel like they can trust what's being said to them. So what we do is we get in there, we talk about, we build the relationships, we build the trust, we talk about medical services, and then we also provide a hub that gives people avenues to other forms of healthcare that they might not be willing to approach if they had not had some kind of a connection or someone that they trust to talk to about that. So we're not just serving the community, we're building their access to healthcare, and we're building their access to other healthcare services throughout the city as well.
May I just add just a bit to that? And I think that it should be known that the IWHC, actually the Birth Control and Sexual Health Center, founded it because of this very reason. We felt that we had to be something more than what we were able to provide. At the same time, as time has gone on, we have staff from the Chinese community, the Vietnamese community, the Caribbean community, the Spanish-speaking community. And I will say the Spanish-speaking community is very, very large. It's growing, and there are many, many without health cards. And we see tremendous numbers. And we do a program once weekly on community radio in Spanish, bringing out basic sexual health knowledge. And we're not just to our clinic, but all the sexual health, the Scarborough Clinic, all of them. So I won't go on at length, but this is the question of equity, who is left behind. And the other thing I just want to emphasize, the alternatives for these communities, they do not exist. They do not exist. Family practitioners, walk-in clinics, emerge, they do not exist for these communities. So this is why it's so critical that and then TPH also, of course, provides without health card, people do not need health cards as well. I don't want to leave that out.
Okay, thank you.
I'd like to also discuss that not only do I echo everything that has been said, but we also are out in the community doing outreach work and testing in the community. So we are also have a presence in the community, reaching people who may not attend in clinic. We are also offering our services in many languages, in the Spanish, especially right now. We are going to be hosting a big forum at the 519 to draw onto the Latino community so that they get an awareness of what's available for them. We've also, through our visits, respond to mental health and addiction services. We provide direct mental health services, and then also we navigate people into ongoing care. So it's not just what we do in clinic, it's also the other services that people might not be aware of. We have a very close relationship with the Ministry of Health Lab, where we've helped monitored resistance, for example, in gonorrhea. We were the clinic that found that a few years ago. We're back onto that right now. So we have established through many years relationships through not only community, but other health services, St. Mike's, Toronto General, and so we continue that. And in order to continue that, we need to continue having our funding.
Thank you so much. I do have one question, and it's a quick one. Have you seen an uptick in refugees in your clinics? And if so, how many, what percentage?
Very much so. I don't think we've had I can't give you right now the percentage, but we're seeing more and more, absolutely. And this is something we have been discussing, going out to those areas, those churches, those hotels, areas where refugees are coming together and being able to provide more information that they have available at this juncture. This is a discussion that's ongoing. You may know more.
I was just going to speak to the fact that, there's definitely been an uptick in refugees and other migrants and other immigration groups. I think one thing, too, to point out is just that people's base level of sexual health education sometimes is very low, and that's general population as well as other populations. And one of the things that we can do in terms of informing people about sexual health education is take away things like stigma and shame and be able to give them that access to solid information, because there's a lot of misinformation out there around sexual health, especially in young populations and older populations. And so being able to provide that access is really critical so that we're able to get it right when people are coming into the country, whether they're as refugees, migrants, or immigrants, or even to the general population.
Thank you so much. Thank you for coming in. Any other questions? I don't see any. Thank you. Okay.
Mr. Chair.
Sorry.
I just, it's not so much a question, because yourself and the deputy mayors have asked a lot of my questions. I just wanted to particularly thank the deputants for being able to so nimbly spring into action in relation to the growing Latin American community, and it's just a demonstration of what it means to have that kind of community-rooted and responsive approach, and it's preventing so much harm. All the work that you do, I just want to say thank you.
Thank you, Councilor Bravo, and through you to deputants. All righty. Well, Althea? Where are we? Okay, if you want, you can stay there. Any questions of staff? Deputy Mayor Morley?
Thank you for the presentation and for the great work. We all know the budget pressures that we're under as a city, and lots of important intergovernmental conversations are underway. I know the working group that was struck with the City of Toronto, along with our counterparts at the province, is meeting currently and having ongoing discussions exactly on these topics. And so I wondered if the ask before us, as it relates to the $21 million additional dollars to get the province back to a space that is the original, I guess, distribution of resources or supports for TPH. Are you aware if that is an active part of the ongoing working group discussions? It's a long-winded question, but hopefully you got my meaning.
Thank you for that question through the chair. No, that is not part of the discussions that are currently underway. As I indicated, this came up during the presentation to the Board of Health Budget Committee.
That's very helpful. And we'll take that as direction to get it on the table there. Thank you.
Okay, thanks. Okay, any other questions? Trustee Srishkanaraja?
Through you, Mr. Chair. Again, thanks for staff for working on this. I just have a question. If there, we spend a lot of money on IT, and of course, we need to constantly keep up with the ever-changing realities. But is there any way if there could be a separate sort of workshop or a resource guide that can be put together for us to give a bit of explanation on what each of the projects are? I know we got a short blurbs in the reading packages. Some of them stand out as something we need to do and perhaps are doing a lot of catch-up work. Some of them, I think maybe just because of my ignorance, sounds like duplicating some of the work. So if there's a sense we can get a clearer picture on the projects being approved and asked for, just because it is a lot of money, and I imagine ongoing funding will be required.
So through the chair, absolutely. I know that sometimes when you do look at the projects, they do like over repeating them. I just want to indicate that the city actually has what I will term it as a gating process. So before you actually go and do like a full-blown IT project, they do want you to kind of scope out the work. So sometimes what you'll see phases. Like phase 1 is the scoping out, and then phase 2 might be like implementation. The other thing is a good practice too is that, and I think I mentioned this when we talked about the EMR project, we're rolling out to sort of 2 of our clinical spaces. We're going to see how that goes, and then if things work out very well, we'll have an opportunity to roll it out to another one. Happy to provide more information to the board on our projects. We're always interested when you're interested in us, so happy to do that.
Thank you. I look forward to that. Thank you.
Okay, thank you. Any other questions? Director Ozade?
Thank you so much for the presentation. My question is on slide number 5 on the electronic medical record. I know in my conversations with the public health staff and Dr. Davila, it's been a big thing, digitizing health records. So it says here that it's a new client information system. Is it completely new? It doesn't exist before?
Thanks very much for the question through the chair. This was a project that was started for our sexual health clinics just before the pandemic and was disrupted by our need to move staff to the response during the pandemic. And so we have restarted this project this year. We hope to finish this early in 2024. So this is a technology or the information system that we haven't used before. So it is new for Toronto Public Health. We went through, as my colleague indicated the city's procurement process before the pandemic to identify the electronic medical record system that we wanted to use for the sexual health clinics. And then we were about to install it, but we disrupted, and now we've restarted this project.
Okay, so there is some data that has been collected already.
No, the system is not yet in use. We restarted the project this year. There was some components of the project that we needed to finish this year, and we hope to be starting to use the system early in 2024.
Okay, so for things around like sexual health and needle exchange, is there, I imagine there's some data that's been collected for the existing ones? Is there some data?
So currently we are using a system that is antiquated or it's quite old, and we're replacing that system with this new system.
Okay. I'm curious as well. I know interoperability is a big thing that's been discussed in the digital health space. So will this new system be interoperable with existing systems of public health or other, healthcare systems?
Through the chair, that is a hope in the future. Right now, we're working with the vendor to make sure that is available in the future.
Okay, thank you.
Okay, thank you. Any other questions? Okay, Dr. Chandravalan?
Thank you. Through you, Chair. I was just wondering, in terms of the electronic medical record, is it going to be kind of similar to the supervised injection sites where it's going to be like a client ID number? I'm assuming we're not going by health cards?
Through the chair, I think each program is going to be using the information systems to meet their needs. And so in the sexual health clinics, we do offer services for people who have health cards, and so we'll be collecting that information. But for other programs, you're right, we'll have various ways of identifying clients.
So in response to what you're saying, would the electronic medical record then speak across all programs? Like the sexual health clinic, the needle exchange clinics, will they speak to each other or no? Can somebody at the needle exchange program, the client number, so if the client's using that service and they have an ID number associated with it, but then also use the sexual health clinic, would that ID then translate?
Through the chair, I think from a privacy perspective, we always want to maintain a client's ability to control their information. So if they're having one service through program, we don't want to assume that that we can have access to that information across other programs because they're seeking different services. If a client feels that that's important, then we can certainly ask that person, but we don't want to assume anything.
Okay, thank you.
Thank you. Deputy Mayor Malik.
Thank you very much.
Do you have a comment?
I was hoping to hear a little bit more about the change of funding to the injectable opioid agonist treatment program and what the state of the conversations with the federal government were on that.
Thank you, Deputy Mayor Malik, for the question. Through you, Chair. We have sent a letter as directed by the board to the federal government, but we do not at this point know what the status of the funding is post March 31st, 2024.
Thank you very much, and thank you for following up on that directive, and we look forward to hearing a response because, as you've shared with us before, this is a really important program to save lives. My other question is about Public Health's home at 277 Victoria Street. We're well aware about its sale, and I'm wondering how the operating budget is taking into account the need for a new location in the near future and the cost of that.
Thank you for the question through the chair. Toronto Public Health is not responsible for the actual move from 277. That's actually coordinated through Creatio. they're in the process of supporting us in finding new spaces for some of our clinical services, as well as identifying a new space for the operating sort of office areas within the building. The actual move itself is going to be funded by Modern TO. And when the building was first sort of identified as releasing, its potential, that was put forward as part of the business case. So there is no, and there should be no operating impacts on Toronto Public Health's operating budget in the end.
Yeah. Those are your questions? Okay, thank you. Any other? Dr. Zhao, go ahead.
Thank you. So I just wanted to clarify around the IOAT program. It said in the board materials that the contract with Health Canada was actually extended until March 2024. So is the IOAT program going to close March 2023 or March 2024?
Through the chair, thank you for the question, Dr. Zhao. We have funding until March 31st, 2024.
2024.
So it was, we were provided funding for the first year and then extended till March 2024.
Okay. And then my second question is just around the, to follow up on the vaccinations and how right now we have the yellow card for vaccines, but Toronto Public Health was exploring a more universal database for vaccination records. Is that part of the EMR funding, or we haven't found any funding for that?
So through the chair, that is a completely separate issue. The EMR project right now is in respect of providing clinical records or supporting the need for clinical records within our sexual health clinics at this point in time. When it comes to other records, vaccine records in particular, I believe what we were talking about and what you're referring to is a broader provincial effort around ensuring better access across the board to immunization records. So separate, I think, from this.
Okay, thank you. No further questions? Okay, I do have one. Just for clarification, I know the answer to this, but it's important that the public recognizes this. We talked about the SIS increased funding for security or index funding. Can you just elaborate as to specifically which location you're talking about? And also indicate that public health does not fund SISs outside of our own facility, just to clarify for the public.
So thank you, Chair. When we're talking about the supervised consumption service, the one that's referred to here in the budget presentation and in the report, we're talking about the supervised consumption service that is actually operated by us at Toronto Public Health. This is the only one over which we have purview, direct purview. So we're talking about the location at the works. That's currently at 277 Victoria. That site has been sold. We just heard about that. And we are working with our partners at Create TO to find a new location for all the services at 277 Victoria.
Okay, thank you for the clarification. And just in regards to the deputants that spoke about from Hassle Free and the Immigrant Women's Health Center and the Birth Control and Sexual Health Center, is there any, will we be continue to fund those facilities, or is there any chance of funding being cut, or what's the status of all that?
So through you, Mr. Chair, there is no plan to make any change to the funding that these facilities receive. I will say, though, that it's important to note that as per city policy, they do get year-over-year increases in respect of inflation or cost of living. So, and that is determined by the city. So these are important services, no question. I would say that this is an opportunity, however, for the board to consider that which is really needed in terms of healthcare services, yes, in the city, but I think those healthcare needs exist across the province. In fact, the deputant spoke to the need for better primary care, including sexual health services, in a manner that actually meets the needs of populations that have not been traditionally well-served. So they do fulfill an important function. I think they spoke to stigma and all kinds of other issues that are impeding the ability of people to enjoy better health. And I think that there's a real opportunity for us as public health to focus on that which we do at the population level to help support these clinical activities. So I'll just remind the board that there is an opportunity to advocate again to the province in respect of necessary healthcare services. I think you heard the deputant speak to the 2.2 million people in the province of Ontario that's the estimate of the number of people who do not have regular access to primary care. Unfortunately, in the City of Toronto, when I speak to family medicine colleagues, they tell us that that number for Toronto is in the range of about 425,000. So there's no question that there's need for better service in respect of primary care, which includes important sexual health services. And I think there is an opportunity for this board to continue to advocate to provincial partners on the need to provide necessary healthcare services as part and parcel of preserving the acute care services, which we know are under significant strain.
Thank you, Dr. Davila. Seeing no other questions?
I just have a, if you don't mind.
Oh, sorry, go ahead.
Just some clarification around the electronic medical record. What stage of implementation is it now?
Through the chair, we're just finalizing training and configuring the system for use in our clinics and with the harm reduction program. So we're really towards the end of our implementation process.
Is there a timeline on when it will be ready?
We hope that we will complete the project and implement the system in the first quarter of 2024.
And just for the board, could you give us an update on that when it's been implemented?
Oh, for sure. Okay.
Thank you.
Okay. Thank you. Okay, I think so any speakers to the item? Okay, seeing none, I will then speak then. I have a motion. So for item 7.2, Toronto Public Health 2024 operating budget submission, there is a slight amendment from the budget committee. So really it's just a correction that the Board of Health amend recommendation 1 by deleting City Council and replacing it with requesting the mayor to propose a 24-24 operating budget to City Council for Toronto Public Health. Again, with the strong mayor powers, the budget is no longer the council's, it comes from the mayor's office, from the mayor. So it's just, that's a change. All those in favor of the amendment? All those opposed? Carried. And all those in favor as adopted as amended? Opposed? Carried. Okay, and we also have a similar motion for item 7.3. Thank you. And it's actually a correction like the first. So again, deleting City Council and replacing it with the mayor. And again, I just want to take this opportunity to thank my colleagues in the Budget Committee who put in some work into this. And also, of course, to staff who did most of the work. So thank you, Arita, and your team. Thank you very much. All those in favor? All those opposed? Carried. And as item as amended? All those in favor? Opposed? Carried. Thank you. And the next item is item 7.4. Let me find my place here. HL 7.4, Toronto Public Health Strategic Planning. There's a presentation. Dr. Davila, you want to present?
Thank you, Mr. Chair. And yes, this is the last report and presentation of the morning. I'm very conscious of the fact that you've been sitting for quite some time. You know, I'm hoping that this will be more of an interactive process. I certainly will be taking you through a slide deck, which should be coming up on the screen very shortly. But, you know, for those of you who've not yet had a chance to stand up, you know, please feel free to do so. I do feel a little bad that you've been, you know, confined to your seats for quite some time this morning. We'll try to make this as lively and as interesting as possible. So members of the board, this actually I think is a really exciting moment for us as we are about to embark on what I hope is an exciting journey, the journey of developing a new strategic plan for Toronto public health. You know, you've heard at least through some presentations this morning and certainly presentations over the course of the last several months, we are in a point where we're emerging from a pandemic, the most significant public health event of the last 100 years. No question it's had impact on Toronto's health. There are also ongoing areas of health concern, which I know we've had opportunity to discuss here at this table. You certainly hear about it through the various media, and I'm sure you encounter it as you go out and about and interact with your constituents all around the city. I think what we're really hoping to do is have a beginning conversation around how we work together in terms of moving forward to address the health of the city. We need your insights. We need your thoughts. We need your expertise in connecting with people throughout the city of Toronto so that we can develop a strategic plan that helps us navigate what is truly a very complex set of circumstances that we face together as a city, emerging from a very significant public health emergency and in an environment that is characterized by many of the challenges you hear about all the time. Affordability issues, challenges around social connection, challenges around housing and access to housing. There are just so many issues that are really facing and impacting on the health of our population. And we're hoping that this strategic planning exercise helps us create you know, a way forward, emphasizes areas that we need to focus on together so that we can rectify some of those challenges. So on to the next slide, just a very high-level agenda is what I hope to discuss and cover in this presentation and for the remainder of the meeting. The first is dedicated to a bit of an overview on the strategic planning process. We've done a little pre-work here for you in respect of steps and methodology in strategic planning. I would like to review that with you and open then to a discussion around what your thoughts are as we present some of the things that we've looked at and some of the, whether you call them best practices or methods of strategic planning. Interested in getting your insight and input on what we've come up with and what we're proposing at this point in time. The second part of the presentation, we're going to focus on the context within which we're planning and some key considerations that I think really need to be at the fore in the discussions on strategic planning based on what we're seeing. Of course, this is a conversation. We're interested in hearing your thoughts as well. Hence, my hope is that while we're presenting some elements of context, some elements for key consideration, we're hoping to hear and have more of a discussion on this issue than just a unilateral or one unidirectional, I should say, presentation. So again, as we go through the presentation, please feel free to note down any questions. Very, very interested in hearing your thoughts and to hear your insights, as I think that's going to be very key to a successful process. So next slide, just moving through the strategic planning process and going through a very high-level summary. I will not linger on this. Strategic planning, we've had the opportunity to discuss and to chat with each of you members of the board individually, just at a very high level. What are we talking about when we talk about a strategic plan? Really, we're talking about, a method by which we help set the direction for the organization. It is a process by which hopefully we improve our organization, determine goals, and ideally it's something that helps us figure out together how to set priorities, how to make decisions, and it should guide as well our efforts in measuring our success in achieving those objectives. It obviously really must be agreed to by all. If it's going to be an effective resource, it does need to be agreed to by all key stakeholders. It has to be highly visible when decisions, and especially the most critical of decisions, are being made, and ideally regularly updated as the environment changes. Again, going to the next slide, just a high-level summary of benefits. Again, this is part of our preparatory work, understanding what are the benefits of going through this strategic planning exercise. It's an opportunity to make sure that we're all aligned, that our stakeholders are unified behind that which we are doing and that which we're seeking to do, whether it's through specific programs or services or whether it's through positions and advocacy. It has the opportunity to really empower our communication to help us better convey what our objectives, our strategies, and what our progress is to all our stakeholders. Ideally, it inspires progress. And finally, it is it's a very powerful vehicle at its best in terms of helping us fulfill our mission. So on to the next slide. As I mentioned, we've actually had the opportunity, I and staff have had opportunity to speak with the board members individually. So it's patently clear to us that you've had opportunities in the past to participate in strategic planning processes. And I know that you know that there are, I don't know, a myriad, countless even, strategic planning frameworks. But generally what we observed as we did a little bit of research in advance, recognizing that we were coming to a strategic planning exercise or embarking on a conversation on a strategic planning exercise, what we found is that in the public sector or the not-for-profit space, generally you see the strategic planning process organized around 3 broad steps, and they're articulated here on this slide. The 3 steps are organizing, imagining, and then launching. So if this seems like a reasonable process to you, again, very interested as we engage in discussion, it is something, or it's an arrangement that has been used, as I said, quite heavily within the not-for-profit and or public sector or sector. And there are often variations on the theme, but you can see that it starts off with some preparatory work and listening. Then there is significant work around envisioning what are the priorities, really getting into the discussion around what's most important, and then putting that together into a plan, and then moving towards a phase where you actually execute the plan and then evaluate to make sure that the objectives that were sought in developing the plan are actually being moved closer towards, if not outright achieved. So moving to the next slide, this takes this sort of process down to more detail. Looking at this and suggesting this is a bit of a framework for our strategic planning. And in preparation for this meeting, staff at TPH have identified some key actions in each area as described under this framework. So we talk about the prepare work or the activity of preparation. We've actually undertaken some jurisdictional scanning for best practices, and we'll get to that later in the discussion. We've looked at previous strategic plans for our organization, and we've looked at, for example, at the health indicators as outlined in the population health profile, which we discussed earlier this year and that we refer to time and time again. I think, that's a significant amount of the preparatory work has been done. We're now, again, we'll discuss that which we've prepared for you. And we're now looking into the listen stage where we are now seeking to listen to feedback and insight of community stakeholders and others. I'll have more on that in the presentation later. We've had the opportunity to speak with you one-on-one, and we're here today to speak with you as the Board of Health as a group this time around. So there's also the opportunity to review community feedback through other processes, whether they're done by the city or done by us in respect of very specific programs. We've had lots of opportunity to engage with community and to make sure that we're hearing oftentimes on very specific subjects, But those kinds of inputs are, of course, relevant to this endeavor as well. We do hope to then move to the next phase around envisioning the plan, which involves engagement of key stakeholders. And clearly, this happens at the direction of the board. There has to be input from community, from our own staff, and of course, other city divisions who are also important stakeholders. And then finally, you'll see at the last stage of this framework as proposed here is to actually launch the plan, executing, presenting the plan to the Board of Health, developing operational work plans that then stem from or flow from the strategic plan, and of course, come up with an evaluation mechanism to ensure that we're actually achieving on that which we set out to do. So turning to the next slide, this is probably something that you're familiar with, recognizing that you have all been engaged in strategic planning exercises, albeit not here, other organizations, but fundamentally components of a strategic plan look like as articulated here on this slide, starting at the highest level with a vision, mission, and values, and then becoming more and more specific as we work down into priorities, very specific objectives, and then operational work plans. This is, again, just a bit of a framework on what strategic plans generally look like, and certainly that's been the case here at Toronto Public Health. We'll see that as we get later on into the presentation. So with that, next slide. Our proposal and what the recommendation for you at this point in time is that we're recommending that the Board of Health seek to establish a strategic planning committee to guide the development of the next strategic plan. And currently we're suggesting that it cover the next few years from 2024 to 2027. I think this affords a smaller group of Board of Health directors to meet again, in a more contained, smaller environment, to actually get more into the discussion around the strategic planning process and the content. And certainly, it does provide a venue for the public and stakeholders to participate. I think I look at this as not dissimilar from, say, for example, the budget subcommittee of the board. It just allows for a greater opportunity to delve into some of the issues and have that committee then come to the board and make recommendations on those issues that they identify, things that they plan, recommendations on both engagement and the content of the plan. So the focus, as indicated here on the slide, will be on designing community engagement processes and setting priorities. And again, I would describe this as akin to what the budget subcommittee does for the board in respect of the budget. So with that, next slide. This is a little bit of a different format. I'm very interested in hearing whether the Board of Health members have any thoughts on that which has been outlined by way of strategic planning thus far in the presentation.
Any questions of Director Chandrabali?
In terms of engaging the public as well as stakeholders, what does that look like to you? What kind of model do you think that we'd follow? Would it be like an online forum that people can submit feedback to, or would it be a more facilitated conversation?
So through the chair, in the past, both those methods have been used. I think that's certainly one of the subjects for conversation at the strategic planning committee that we're proposing that the board forms.
Okay. Any other questions? Okay. Seeing none. Deputy Mayor Morley.
Thank you. Less of a question, just a comment in response to the question. Through you, Mr. Chair, I think this is really timely. It's very important. My understanding is it's been some time since Toronto Public Health has really had the bandwidth to really look at a strategic plan in this kind of intentional way. Obviously, all of the efforts and all hands on deck through the pandemic. And so just wanting to offer myself as part of the working group and look forward to this important discussion. I think the great part about the way in which this is being approached is that there'll be a lot of opportunity for members and folks to help design what does that engagement look like. And I think it being multi-pronged is going to be really important because of the impact of the strategic plan at a citywide level, but also I think there are a lot of opportunities. I'm thinking of SafeTO as a strategic direction that the city has identified, which is a massively large undertaking and involves all divisions and departments. But I think we all appreciate when we talk about safety, wellness is at the center of that. And so one of my initial thoughts as it relates to the strategic planning process is kind of keeping in our mind's eye some of the other priorities that we may have as a city and hopefully aligning through the work that we will undertake here through the strategic process. So thank you. Those are my comments, Mr. Chair.
Thank you. Councillor Thompson?
Thank you very much, Mr. Chair. Through you to, I guess, Dr. Davila. It's not clear to me, and I wondered, through the process that you're envisioning here with respect to the strategic planning, are you planning to have an outside independent party come in to assist and lead along with the obviously the motion that the chair is moving forward with the members of the committee? I'm just wondering how that process will work.
So through the chair, Councillor, at this point in time, that's not actively accounted for. However, it is certainly something that can be discussed at the committee.
Then just to follow up on that a little bit further, would it not be wise in light of, COVID, in light of the comments that's been made today around the perspective that some people have about either public health or just health in general, would it not be wise to strongly consider an independent third party to co-jointly advise and help to lead and direct and work with the committee that the chair is going to be putting forward with respect to the motion that he's moving?
So through you, Mr. Chair, I would suggest that that's something that I would ask the board to weigh in on, and as well for the proposed committee to consider. Again, the notion here is for the committee to function in a very similar fashion, to provide recommendations, to be able to delve into the issues that are germane to strategic planning in a similar fashion to the way the budget subcommittee delves a little more deeply into the issues on behalf of the board, and then comes back to the board to present that which they've discovered through their deeper dive and make recommendations again in follow-up to having had the opportunity to look at those issues more carefully.
Gotcha. So at the appropriate time when the committee does its work, they'll come back with, as you point out, I gather, a series of recommendations, and those recommendations could be added to, subjected to the conversation that will take place at the Board of Health?
Yes, so I think that's exactly how the budget subcommittee works, and I would imagine this subcommittee would function in a very similar fashion.
Gotcha. Thank you. Those are my questions, Mr. Chair.
Okay.
Chair, I just have a couple of quick questions, if that's possible.
Yeah, my mic was not on. Go ahead, Councilor Bravo. I'll pick up after you.
Thank you. Thank you. I just wanted, for the sake of anyone watching this, just to pick up on Councillor Thompson's question, just to confirm that it is the board's responsibility to sort of be in charge of its own governance and therefore participate in this kind of vision setting and objective setting along staff. Is that one of our responsibilities?
So you want to repeat that, Councilor?
Is that a question for, I'm just trying to determine, is that a question for me?
Yeah, if you understand that, like, if this is coming because we are responsible for governing our own, like the board, and how we contribute, but also to sit alongside staff to take a look at the future directions and strategic objectives that Toronto Public Health will undertake. That's historically how it's worked. Is that correct?
Yes, so through the chair, yes, that's correct. And in fact, there is a standard under the Ontario Public Health Standards that speaks to the need for the Board of Health to have a strategic plan, with a specific, covering particular time periods, and as well a process by which to review it regularly.
Great. And in terms of securing additional support, one sort of function that might be potentially resourced externally, could that be something like facilitation to ensure that staff and board members in the subcommittee and the board as a whole are able to effectively contribute without having to play dual roles?
So through the chair, yes, and that was, I hope that was what I was conveying through my answer to Councillor Thompson, that, whether a facilitator should be brought on board to support the process is a decision I would put absolutely, at the board's feet, and or with the support of the subcommittee that we're proposing will be looking into the details of the strategic planning process.
Thank you.
Okay, thank you. I'll try and start again. My mic wasn't on the first time. Just to pick up on what Councillor Bravo and Councillor Thompson were referring to regarding a facilitator. As I mentioned, I participated in the strategic plan at the school board, and we did have a facilitator who had a lot of experience and knowledge about school board issues. What steps have other jurisdictions taken when it comes to forming a committee and having a facilitator? Is there best practices?
So through you, Chair, it varies as much as there are, there are as many variations as there are local public health units. Some of our other colleagues, we know, because we've been in touch with them, have largely managed it within their own. And didn't set up subcommittees. Others have hired external facilitators. It varies depending on the circumstances, and it varies with the will of the board, the interest and the will of the board with respect to bringing facilitators on board.
Okay, thank you. Those are my questions. You may continue.
Okay. So we'll keep going through the presentation, and we'll go to the next slide. This component of the presentation actually is looking at key considerations and setting a little bit of the context. What is the context within which we're doing strategic planning at this time? It is actually, germane to the exercise. So going to the next slide, I won't linger on these for very long. This is a board that is incredibly attuned to that which drives health, that which actually creates and maintains health. And there's no question, we know that this is about the social determinants of health. There is no question that service and programs actually are helpful, including healthcare services. But at the end of the day, what really creates and maintains health are the conditions in which people are born, where they grow, where they work, where they live, and where they age. And these are indeed the social determinants of health. Turning to the next slide. As a local public health department, we are very mindful of how we can use different tools to help us conceptualize the different levels of intervention that are needed to address public health problems and issues at scale when we're talking about population health. This is a tool that was developed by Tom Frieden, former director of the CDC, trying to outline how different levels of intervention are needed in order to address any particular issue, but that impact is achieved when we address issues at the socioeconomic level. Addressing those factors actually have the greatest potential to deliver on impact whereas those that occur at a more individual level clearly can be helpful at the individual, at that level, but don't have the capacity to deliver quite at scale as population level interventions. That's not to say that we don't do them. It just means that it takes a variety of different interventions at different levels. But at public health, when we're trying to, work on that which really creates and maintains health, we're looking at the social determinants of health. And we try as much as possible to have our impact at the lower levels of the pyramid rather than the higher levels. Turning to the next slide, it gives you an example of the health impact pyramid and its use on one specific item, childhood and youth nutrition and healthy eating. Again, I won't linger on this slide, just to say that you can see that there are interventions that can occur at all levels of the health impact pyramid, but the ones that move, as you move towards the bottom of the pyramid, as you move towards those interventions, you have greater capacity to impact on population health, and you have a decreasing need for individual effort or individual behavior change in order to actually appreciate the benefits of the intervention. On to the next slide. We would not be serving well in terms of public health if we didn't talk about health equity. I titled this component of the presentation Key Considerations for Strategic Planning. But I think it's really important that we all together appreciate and stand behind the fact that health equity isn't just a consideration in our strategic plan, it's actually the foundation. It's the foundation of what we do in public health, and it should be therefore the foundation of our strategic plan. It should be embedded in all aspects of our work, and that should be reflected, I think, in a strategic plan if it's to be true to that which we want to achieve by way of public health. And I know this is not an audience that needs any convincing in that regard, but I did want to make sure that it was actually placed front and center. It is an important foundational, fundamental component of that which we do. Turning to the next slide, I've already mentioned this in respect of answering a question, and this is the Ontario Public Health Standards. I'll remind the board that, of course, the Ontario Public Health Standards they basically articulate the requirements of the Board of Health in terms of what is expected of the board to deliver, and these are published by the Ministry of Health of the province. There are foundational standards, there are specific program standards, and there are organizational requirements articulated on this slide. And when the new members of the board came on board, we had the opportunity to go over documents and review that which is the responsibility of the Board of Health. Key amongst those responsibilities is affecting the Ontario Public Health Standards. What's not articulated on the slide is that underneath the standards are a series of guidelines and protocols within each program area, and these are responsibilities that we have to carry out as part of our agreement with the province in order to receive the funding that we receive from them. It's also our responsibility and our obligation as articulated in law. And on the next slide, there is a very specific requirement on strategic planning. It's one of the organizational requirements. We are supposed to have a strategic plan that establishes priorities. Again, you'll see it's a variable period of time, 3 to 5 years, depending on what makes sense. Clearly, the ministry had envisioned that this would include input from staff, clients, and community partners. And the notion is that it should undergo regular review to make sure that it's actually delivering on the plan's objectives. So next slide, just going through some other contextual pieces. You will recall we've mentioned it on a number of different occasions because it is basically our diagnosis right now of what is impacting on the health of our population. We have the population health profile presented to the board earlier this year. This is a key resource in terms of guiding the strategic planning process. It is one of our key sources of information regarding the population that we together serve. So this, I think, is an important component and an important piece of context. I imagine it will be one of the resources that will be heavily used by the subcommittee in their deliberations, as it does give a sense as to what are some of the specific challenges. You see a few of those examples articulated here on the slide and on the next slide as well. This is a slide that should be familiar to the board, presented earlier this year, some of the key findings from the population health profile. The fact that we are a rapidly aging city, that we are an increasingly expensive or not affordable city. We have significant issues, and we're feeling the impacts of climate change, to say nothing of mental health and mental illnesses, which are also having significant impact. We've already had a little bit of conversation here today around the drug toxicity crisis and the services that are needed to actually address that. We've heard from deputations, from community members and service providers around sexually transmitted infections. With an aging population, we were, not surprisingly, seeing chronic disease issues being faced by our population. And of course, we just had a presentation earlier this morning in respect of respiratory virus, respiratory virus season and the impact that that has on our population. So yes, infectious diseases will continue to emerge globally and will continue to pose some threats to our health and the health of people who live in this city. Next slide. Other important things to consider, and again, these are just a few highlights. There's no question that we need to consider the extensive network of community partners with whom we collaborate. This slide just shows you a small number of those connections, and these are largely in respect of healthcare and other very specific organizations. We have more than 30 hospitals in the city with whom we partner. As you can see, 3,000 family doctors, almost or over 300,000 students at our various schools, with more than almost 1,200 schools. Childcare centers also numbering over the thousands. We have over 35,000 inspection locations and a variety of different care settings and communities with whom we interact, to say nothing of our not-for-profit sector, other community partners and social agencies, with whom we have direct interaction and whose role is incredibly important in respect of advancing the health and social connection and social fabric of our city. Next slide. Some other key context that we'll be able to provide in greater detail when we speak to a subcommittee or those who might be engaged in a more in-depth conversation around the context. I, along with members of the senior management team at Toronto Public Health, have been visiting a variety of community partners throughout the year. And really what we've been aiming to do is to listen and hear from organizations who are closely connected to the community, to continue to develop the trust and reciprocity that developed over the course of COVID in a very unique and different way relative to what had existed in the past, and to actually learn and hear more about how we might actually facilitate the work of these community partners so that we can better serve our population. And going to the next slide, you'll have a sense as to some of the organizations that we extended invitations to, really thinking about what we heard here at the board. So what we heard here at the board was actually really important for us in terms of determining and identifying organizations that we reached out to, at least at this point in our interest or in our initiative to meet with community agencies. We looked at the geographic distribution and really had strong consideration for geographic equity. I know that many of our board members have spoken to the need and to emphasize that. We looked at those organizations that served traditionally underserved neighborhoods and priority groups, and those that had increased needs over the course of the pandemic. So that gives you a sense as to the kinds of organizations that we've actually had the opportunity to connect with. And on the next slide, we have some of the themes that have emerged through those community visits. These are the themes that we hear about over and over again as we speak to our community partners and others in the community. Mental health, substance use, harm reduction, and the need for treatment comes up over and over again. We hear quite a bit about the social determinants of health. You're not going to be surprised that housing and food security are issues that have figured prominently in our conversations, particularly over the visits that we participated in the summer and throughout the fall to date. Sustainable funding is clearly an issue that many of our community partners are grappling with. And, we're also hearing quite a bit about the need for better newcomer support and integration and the challenges that community agencies are experiencing in trying to address the needs of a significant influx of newcomers who are reporting more and more difficulty with respect to meeting basic needs. And, one of the themes that emerges through our community visits as well is immunization and immunization catch-up. This has been the subject of discussion when we go out and visit with community partners. I think, at one of our most recent community visits, I was really struck by a comment made by one of the agencies, one of the executive directors of an agency. And encapsulating all these themes that emerged, what we heard was, from their point of view, Toronto is becoming a different city, and not in a good way. And that really struck a chord, as I'm sure it will with you. It's a very difficult thing to hear, and something that as I heard it, really thought about how and what we can do better to change that trajectory. And I recognize that that's not all on us at Toronto Public Health, nor is it all on you as a board, but I think we can play a very significant role in terms of actually changing both the perception and, frankly, the trajectory. So on to the next slide. This is the last component of the presentation. I assure you, I'm conscious of the time. A little bit on the history and the context of strategic planning. So, as part of our preparatory work, we thought it was helpful, or it might be helpful to you if we looked back on strategic plans of the organization of the recent past. And when you look back on them, it's clear that the most current version of the strategic plan, which is the one that is dated 2015 to 2019, and even the one before it, covering 2010 to 2014, they're based on the foundations that were described in 2005 to 2009. And that's what you've got in front of you here. This plan was entitled Toward a Healthy City. It's the strategic plan for Toronto Public Health. It articulates the mission statement as being that Toronto Public Health improves the health of the whole population and reduces health inequalities. It speaks to a number of foundational principles you'll see there at the bottom left hand of the slide. And it described 6 priority directions, ranging from improving the health of the city's diverse population through services that are responsive or meet needs, and end at the right-hand side of the slide with being a workplace of choice. Turning to the next slide.
One moment, Council. May I have a motion to extend to the end of this agenda? Councilor Perks, all those in favor? All those opposed? Carried. Thank you.
Sorry, Mr. Chair. Thank you for that. Turning to the next slide, we have the 2010 to 2014 strategic plan. This one was titled A Healthy City for All. The mission statement changed slightly relative to the 05 to 09 version, but speaks to the same core, reducing health inequities and improving the health of the whole population. Foundational principles that were described in that strategic plan are on the bottom left-hand side of the slide in the blue box. and include, as you can see, accountability and engagement, excellence, diversity, and health equity. This time with 5 priority directions, many of which echo that which we saw in 2005 to 2009. And then finally, the most recent iteration of the strategic plan is the 2015 to 2019 plan. The mission statement remained unchanged. Foundational principles, again, fairly similar to that which we saw in the previous plan. And then priority directions, again, some echoing of the previous plan as well that's seen there. So we offer that as a little bit of context. Again, important to see what has the historical strategic plan landscape looked like here in Toronto Public Health. And it's clear that the foundations of the last strategic plans have their roots back in 2005 and the strategic plan from 2005 to 2009. Obviously, we are at the point where we do really need to engage in a strategic plan exercise, if for no other reason than to ensure that compliance with the Ontario Public Health Standards. But as I articulated earlier in the presentation, there are some clear benefits that we can enjoy as a result of having a strategic plan. But turning to the next slide, we have our interim priorities for 2022 and 2023. As we were doing the COVID response, the opportunity, the time to actually engage in a strategic planning exercise just did not present itself. However, as we were waiting for a new Board of Health to be appointed in early 2024, we did want to make sure that in the intervening period that there were some interim priorities guiding the actions and the decisions of the organization. And these included, continuing to respond to COVID-19 and prepare for other emerging health issues, responding to the drug toxicity epidemic, promoting mental health, and of course, rebuilding public health functions as we were emerging or slowly extricating ourselves from the most acute phase of COVID response. And you'll see that there are some basic principles there that are covered as part of those priorities. Some thoughts around making sure that we're doing the best to foster resiliency in our workforce, to ensure effective public health practice, to achieve health outcomes. And I think particularly at this time, what I would offer for the board to consider is the importance of actually really building on lessons learned. This has been, the last 3 years, plus years, has been, really, I hate to use the word, but truly it was unprecedented. And there is an opportunity, I think, for us as an organization, for you as a board, and for us together to reflect on how best we take some lessons learned from what was a very tumultuous time in order to better serve the public and to enhance that which we provide in public service, in public health service to the people of Toronto. So on the next slide, just to give you a sense, the current vision is a healthy city for all, right? Going back to the framework of strategic planning, starting off with vision, this is the current vision. There is an opportunity for the board to either carry this forward or to consider revisiting that vision. On the next slide, we have the current mission, which is that Toronto Public Health reduces health inequities and improves the health of the whole population. Similar to the vision, there is an opportunity for the board and the subcommittee to revisit or carry forward. Next slide. A few more thoughts by way of emerging themes. Based on information that we gleaned from conversations with you and what we were able to obtain through community visits, taking into consideration the findings as well of the population health profile and some of the lessons of the COVID response that really came to the fore, we do see a couple of themes emerging, and that we're putting them here for your consideration. We have heard quite a bit and from you and from others around the importance of mental health, wellness, addressing substance use, and ensuring that harm reduction, is available amongst other treatment services as well. We also heard about a need to focus on, it's funny, it's healthy aging for everyone, but it's actually creating the conditions that actually support people to grow and age in a healthy way. But with an aging population, a rapidly aging demographic, focusing on what can be done in respect of adults and seniors is becoming more important than it might have been in years gone by when, frankly, we were a younger demographically younger city. Preparing for emergencies and building resilience is important, and I think, and something that emerged through the conversations. And I think that this warrants consideration in at least two different ways. One is as an organization, and second is as a city. What can we do to foster better preparation for emergencies writ large and resilience as a city as a whole, in addition to what we can do for us as an organization? And then finally, we heard a lot, given the social determinants of health and the particular challenges that we hear so much about these days, the importance of advocacy on key determinants of health was another key point that emerged in the discussion with you, I should say, in our discussions with you, and discussions with community partners to date. So with that, this is, believe it or not, the last slide, but it is actually the discussion point or the opportunity for further discussion. And this is actually a question to you as members of the board, whether you have interest in re-examining the current vision and mission statements as part of the strategic planning process. Interested in hearing whether there are any first thoughts on the emerging themes and or any first thoughts on the context as it's been presented to date. Again, this is the start of a conversation, and even with a strategic plan, I do hope that it continues to be a very engaging back and forth discussion, as we know how very fluid our circumstances are and how much ongoing conversation is needed in order to be as responsive and as effective as both an organization and the Board of Health in terms of meeting the needs of the population. So with that, thank you everyone for your attention, and Mr. Chair, I will turn it back to you.
Thank you, Dr. Davila. Very comprehensive presentation. Any questions for Dr. Davila? Okay. Seeing, okay, go. You want to speak or you want to? Okay, all righty. Any speakers? Deputy Mayor Morley?
Thank you, Mr. Chair. Through you to Dr. Davila, thank you for the presentation and for the great work that you and your team have been leading. I think, again, really excited about this opportunity. It'll be an important one for us as a board and as a city to put our heads together on and set some directions going forward. I am mindful and I think appropriate to, just as it relates to emerging themes and the connection with mental health, we are experiencing and responding to in real time ongoing conflicts in the Middle East that, being the most diverse city in the world, I think we can confidently say, obviously are seeing really deep impacts on different communities and communities across the board as we sort of navigate the challenges of seeing, the impact of the ongoing conflict. And so I just wanted to highlight that as an area that, whether it's the Toronto Police Service responding, when ongoing protests in different pieces, that the city is going to continue to be engaged in and putting resources towards. I think contemplating and considering as part of our ongoing strategic conversations, those impacts and how we as a city can ensure that there's safe space and really thoughtful approaches to supporting people most impacted and all of those pieces. So I just wanted to put that on the table as it is an ongoing sort of issue that many folks are navigating and unfortunately doesn't seem like it will resolve in the near term. So I do think that might be something for us to contemplate. Thank you.
Okay, thank you. Any other speakers? Director Uzade?
Thank you so much for that very detailed and sage presentation. And just wanted to share some thoughts that I truly am humbled to be, in this really pivotal moment to be designing the strategic plan. I feel like this is the era that we're living in right now. There's a whole lot of wicked problems. Obviously, this is the Board of Health, but we all know that health just goes beyond, your state of mind, illness, and all that. There's a whole lot of, ecological factors that affect our health. So humbled, excited to be, to be on the board as well to plan, but a little anxious, if I'm being honest, because I know a lot of the themes that are emerging or that will emerge are things that we've been dealing with for years, if not decades to come. So just wanted to encourage our colleagues that as we come up with solutions, that we take this into consideration and really prioritize radically innovative, solutions that would have a big impact on our health. One key thing that I just did a control find on the presentation I didn't see was loneliness, right? It's something that I've been hearing emerge in, everyday conversations, right? Social isolation. I know there's a correlation to mental health, but there's a whole lot of correlations to other things. I'm sure we're all familiar that the UK appointed a minister of loneliness a couple of years ago. And COVID really exposed that, not just for the elderly population, but for even younger populations. So I'm curious to see how, coming up with a strategic plan that how we address that. So really excited and looking forward to how it cascades. Thank you.
Thank you. I guess I'm the last speaker, so I do have a motion. Line. Thank you. So the motion reads, and thank you to all those who put their names forth for this subcommittee. There's a lot of interest. There we go. So the Board of Health established a Board of Health Strategic Plan Development Committee to approve the terms of reference as detailed in attachment 1 to the motion by myself. And 3, the Board of Health appoint the following Board of Health directors to the Board of Health Strategic Plan Development Committee for a term of office ending upon the completion of the committee's mandate or the end of the current city council term, whichever comes first. And so I've appointed Director Bravo as the chair of the committee, and the committee includes Deputy Mayor Morley, Trustee Trish Kandaraja, Director Chandra Bralin, and Director Uzade. And 4, direct the committee to meet at the call of the chair of the committee, the subcommittee. Any questions on this motion? No. Okay, all those in favor? All those opposed? Carried. Wonderful. You have a lot of work ahead of you. I've sat on one of these things before. Yes, you'll get into the weeds of it. So good luck. And this ends our meeting. And thanks you everyone for being here and participating. Have a good afternoon. All righty.